Hey everyone, it's about noontime Eastern Standard Time, sorry, on 4/14/2020. My name is Dr. James Lyons-Weiler, and I'm coming to you from the WWDNYK studios with the podcast Unbreaking Science. Today we have a review of exactly what is going on if you're not paying attention. I'm going to look at exactly the prevarication that Dr. Fauci has been meddling in um, when confronted directly with a specific question from Jake Tapper of CNN, followed by an analysis of how the media then spun that reaction, specifically CNN, in a manner that is non-journalistic. It belies uh, utter and complete contempt for reality. Save CDC's reputation at all costs, even if it brings the end to a presidency. Well, for some people, they would say that that's an added benefit. So we're going to get into this. It's going to take a while. Make sure that you tag a friend on Facebook, share it on Twitter, and this is going to be an important broadcast. The first thing that I want to do is I want to bring up the Jake Tapper and set this up. Here, Jake Tapper of CNN Politics asks Anthony Fauci a few days ago, "Do you think lives could have been saved?" Let's go to that. Right here.
Dance party starts now.
Sorry
Play
about
my
that.
Bad Girl Snapping playlist. I make it look so good. I make it look so good. I make it look so good.
Dance, Cookie, dance!
Introducing AT&T TV.
Korea and the U.S. announced their first confirmed coronavirus cases at virtually the same time in late January. If you take a look at where we are right now in the U.S. now has 50 times more cases and almost 100 times more fatalities than South Korea. Meanwhile, while the U.S. makes up only about 4.25% of the world's population, the U.S. has 30% of the world's reported coronavirus cases and almost 20% of the reported coronavirus deaths. Sanjay Gupta said this is all because we got started too late in the U.S. Is that right? Do you agree?
You know, it isn't as simple as that, Jake. I'm sorry. I mean, to just say this is all happening because we got started too late. Obviously, if you look, could you have done something a little bit earlier? Would have had an impact, obviously. But where we are right now is the result of a number of factors. The size of the country, the heterogeneity of the country. I think it's a little bit unfair to compare us to South Korea, where they had an outbreak in Daegu and they had the capability of immediately, essentially, shutting it off completely in a way that we may not have been able to do in this country. So obviously...
Okay, right there I wanted to stop that for a moment and say that what he's not saying, and we're going to go back to it. But what happened was Sanjay Gupta came out and said that, yeah, there seems to be a problem here that we didn't get our testing right. Sanjay Gupta specifically nailed it this time in saying that the U.S. screwed up on testing. They absolutely didn't get testing right. And to go back over what I've been covering here and reporting, and it's so important that you understand that the CDC had access to a test distributed by Germany, validated already in the lab by Germany, and adopted by 140 other countries. And in order to maintain primacy in the United States as the centralized authority to which everyone has to turn to have their test validated, CDC said, no, we're not going to use the Germans' test. We're going to make our own. And it befuddles the mind why they would feel that they had to make their own when all they had to do was check their email, and therein was the information on how to create the primers. They could have distributed that to all public health departments, all medical facilities. They could have made the tests locally in their own labs, and they could have started right away. It's not unfair, Dr. Fauci, to say that we could have done this. And the fact that CDC didn't is bad enough. The fact that you're prevaricating, and now watch this entire interview, he doesn't mention testing once. Watch this again. Well, I'm going to restart it if you don't mind.
Because of one factor. It's very complicated, Jake.
The New York Times reported yesterday.
Head start, but I don't think you could say that we are where we are right now because of one factor. It's very complicated, Jake.
The New York Times reported yesterday that you and other top officials wanted to recommend social and physical distancing guidelines to President Trump as far back as the third week of February, but the administration didn't announce such guidelines to the American public until March 16th, almost a month later. Why?
Okay, I want to stop that right there before he answers. And here's the deal, okay? The dates that you were just told was that somebody at CDC thought that social distancing might be a good idea. Social distancing is different than physical distancing. The language here has to be paid attention to. Social distancing is where you're not shaking hands, you're not hugging, you might not go to large groups and so on. That is something that I advocated late January. The date that Jake Tapper was just talking about was late February. Okay, late February is too late. He and Anthony Fauci have skipped over the entire two and a half weeks between mid-February, when the Germans came out to the World Health Organization with a report and said, hey, we have a test. And okay, now we're going to jump to social distancing. Now, it could be argued that the CDC thought that their test was fine and that they, unbeknownst to them, they shipped out a flawed test. But that itself is the problem. It is as simple as one factor. One factor is responsible for all of the economic downfall, all of the economic downturn. One and one factor only. And that was the CDC's feeling that they had to put themselves first to be the primary centralized authority for testing. The primary centralized authority for testing shipped out a flawed test. That flawed test was irrelevant. You might as well, in an exponential process, you might as well not even test if you have a test that allows too many false negatives and false positives. It's a disaster waiting to happen. They might have gained us 4 days, maybe 4 days. Okay. In an exponential process, they didn't do anything. In fact, they made it worse. They made it worse because they gave people confidence that they can go out into social areas and so on. So, but let's hear this question again and Fauci's response. Okay.
Homogeneity of the country. I think it's a little bit unfair to compare us to South Korea, where they had an outbreak in Daegu and they had the capability of immediately, essentially, shutting it off completely.
Because they had an
in a way
accurate
that
test.
we may not have been able to do in this country.
Because
so
he's
obviously,
fucked up.
it would have been nice if we had a better head start, but I don't think you could say
No, it wouldn't have been
we
nice.
are where we are right now because of one factor. It's very
would have been
complicated,
nice.
Jake.
Okay, go ahead.
The New York Times reported yesterday that you and other top officials wanted to recommend social and physical distancing guidelines to President Trump as far back as the third week of February, but the administration didn't announce such guidelines to the American public until March 16th, almost a month later. Why?
You know, Jake, as I've said many times, we look at it from a pure health standpoint. We make a recommendation. Often the recommendation is taken. Sometimes it's not. But it is what it is. We are where we are right now.
Do you think lives could have been saved if social distancing, physical distancing, stay-at-home measures had started third week of February instead of mid-March?
You know, Jake, again, it's the what would have, what could have. It's very difficult to go back and say that. I mean, obviously, you could logically say that if you had a process that was ongoing and you started mitigation earlier, you could have saved lives. Obviously, no one is going to deny that. But what goes into those kinds of decisions is complicated. But you're right. I mean, obviously, if we had right from the very beginning shut everything down, it may have been a little bit different. But there was a lot of pushback about shutting things down back then.
Okay, so that's bullshit because the option wasn't shut things down and then everything will be fine. The option was do accurate testing combined with contact tracing. They had a flawed test, and through that flawed test, they could not do meaningful contact tracing. So It's bullshit to skip over and say, if we had locked everything down then yeah, sure, it would have been different. Okay, he's begrudgingly saying that. Like, I don't want to blame the president, but yeah, okay. That's bullshit. Anthony Fauci has covered up, and notice he's not saying the word test. If we had a process in place, then yeah, we could have done something. Come on, say test. Say that we fucked up and we didn't have an accurate test. Say the word test. Say it. He's not going to say it the whole time. Okay. And what this is it's a layup to blame President Trump. Whether you love him or not, or you hate him, or you don't care about President Trump, the fact is CDC and the FDA and the media are playing fast and loose with the truth right now. They're misguiding the public. They're further politicizing of this entire outbreak to try to make it look like President Trump in some way could have influenced what his people told him. President Trump's positions were 100% determined by the information that was made available to him. And you'll find out later in this program that he was lied to by the CDC. And I've done this before, but I'm going to do it again. You're going to want to share this, and you're going to want. Now, let's look at what the media then does when it looked like, okay, wait a minute. Did Anthony Fauci just blame the president of the United States for this outbreak? It sounds like he did. So you've got one layer of cover-up already, one layer of lies over not mentioning test. It's not being forthright. It's not telling the full truth. And it's saying, yeah, if we had a process. Come on, say test. Okay, now watch this. Okay, watch this CNN news coverage here, where they just do a further burying job of reality and twist this around and spin it in favor of the CDC at the expense of the truth. Let's watch this.
The president called Dr. Anthony Fauci to the podium to explain the remarks that Fauci made yesterday with CNN's Jake Tapper about whether social distancing efforts could have prevented fatalities had they been imposed in February, not in mid-March. Here's what Dr. Fauci said on Sunday.
Obviously, you could logically say that if you had a process that was ongoing and you started mitigation earlier, you could have saved lives. I mean, obviously, if we had, right from the very beginning, shut everything down, it may have been a little bit different.
A little bit
now,
different.
What he says is clear, and it's just a fact. He isn't attacking the president, he isn't attacking the administration, it's just a fact. That was yesterday. Here's Fauci today when he was called up by the president.
Okay, hang on. I want to say something here. The CNN reporter is validating Fauci's statements as fact. Okay, see what they did there? It's a half-truth. The misdirection is he wasn't blaming the president, so we have to protect Fauci because he's a career survivor. He'll be here for another 2 presidents. He'll be here for another 3 presidents if he can. Same thing with the other people that are guarding the bodies at the CDC, okay, over other issues that we know about. Now, let's see what he has to say now. And, of course, look at the bylines. This is nothing new. People have seen that Trump is under attack from the media from day one. But now we're talking about the entire American public being on lockdown, our economy going into the shitter to save CDC's reputation. And I've told people time and time again, focus on the testing error. That explains it all. Watch what they do with it. And now it's coming to fruition. Watch what he does here.
I had an interview yesterday that I was asked a hypothetical question. And hypothetical questions sometimes can get you into some difficulty because it's...
Get the fuck out of the ivory tower. There are people that are in hospitals in Detroit dying. It's not a hypothetical question. In reality, could we have saved lives if we had an accurate test, Dr. Fauci? Is that a hypothetical question to you? Get the fuck out of the ivory tower.
What would have or could have. The nature of the hypothetical question was if, in fact, we had mitigated earlier, could lives have been saved? And the answer to my question was, as I always do, and I'm doing right now, perfectly honestly, say, yes. I mean,
so what he's doing there is he's recasting the question. If something had been done differently, could lives have been saved? And he said the nature of the question was whether we could have done mitigation. No, the nature of the question was what could we have done differently that would have saved lives? It was a wide open question. So for that, I have to give Jake Tapper, he didn't give a softball question, just asking about mitigation. But Fauci led him to the topic of mitigation. Tapper could have gone back and said, yeah, but wasn't there a testing fiasco? So +1 for Jake Tapper, -1 for Jake Tapper. Let's look at what he says further here.
Obviously, that was taken as a way that maybe somehow something was at fault here. The first and only time that Dr. Birx and I went in and formally made a recommendation to the president to actually have a, quote, shutdown in the sense of not really shutdown, but to really have strong mitigation. We discussed it. Obviously, there would be concern by some that, in fact, that might have some negative consequences. Nonetheless, the president listened to the recommendation and went to the mitigation. The next second time that I went with Dr. Birx into the president and said, 15 days are not enough. We need to go 30 days. Obviously, there were people who had a problem with that because of the potential secondary effects. Nonetheless, at that time, the president went with the health recommendations, and we extended it another 30 days.
Okay, so in a court of law, although I'm not an expert in law, when you ask a witness or a suspect a question on day one, and it gives you one answer, and then you ask them the same question again on day two, and it gives you a different answer, you have impeached that testimony. Okay, so Dr. Fauci now is you can say he was just backpedaling or whatever. This is status quo. This is what they do all the time. I don't want to hear it. We have hundreds of millions of people who are running out of their stash of food. They're not working. They may or may not get emergency checks from the IRS, which, we'll see who gets those. The economy is at a standstill. I could go on and on and on. There are some people, I love it when he hand waves. Hand waving doesn't cut it. He's trying to walk a thin line here, but remember, the issue is not whether he pointed a finger at the president. Okay? What they want to do is point the finger at the president by having Fauci point the finger at the president, but it wasn't Fauci that pointed the finger at the president, and now experts are going to say. Okay? And this allows Fauci as a careerist to stay in place, and it's written all over everything that he's said. And he's working in combination with the media, it's really clear, as you'll see in a moment, to spin all of this into, yes, Trump should have done something more. And the general public's impression is that Trump should have done something more. And I'll say it again. They lied to Trump about the accuracy of the test. They lied to Trump about whether there was a problem with the test. Right from the beginning, when they let the people out of the Princess cruise ship, they said it was Trump that demanded that they be released, which was bullshit. They tested the people. They were going to drop them off at a mall after being tested. This is your CDC, okay? This is the brilliant minds at CDC, okay? So now, here he is, the great Anthony Fauci on CNN, giving this bullshit excuse about, well, there was just people have difference of opinion. Things happen, some things happen. Let's watch.
So Fauci stood by what he had said on Sunday to Jake Tapper, but he made sure to point out that he wasn't criticizing the president. And he pointed out that the times he was actually asked to meet with the president and made a direct recommendation, the president backed his recommendations. Now, you might ask, why wasn't Fauci invited in much earlier and asked for recommendations? Because he clearly wanted stronger efforts earlier. Nevertheless.
Now, you might ask, why wasn't Fauci invited in earlier? Dr. Fauci is the director of the NIAID. I'm sure that Dr. Fauci can write a memo at any time, pick up the phone at any time, get a message to Donald Trump at any time. This is such I don't know how to say it. It's a web of fabrications. The insinuation that the news reporter is stating here is that somehow it is just presumed that because something went wrong, it must be Trump's fault, and so obviously Trump should have invited him earlier. No, what Trump should have done, in my opinion, to show true leadership, and I'm very critical of Trump on this right now, is the minute that we found that there was a flawed test that had shipped out, he should have, and I'm not saying this in retrospect because I felt that way at the exact time that it was happening, he should have, invited him in earlier and fired his ass on the spot and fired the director of CDC's on the spot and fired whoever made the decision that they needed their own test and then they fire them all, because there's plenty of talented people in this country that can create a PCR test from an email. That's as complicated as it is to make that German test work in our labs. Okay? But no, dependent on their expertise, and they're spinning this and spinning this and spinning this towards the vaccine, got to have the vaccine, right? I was going to do a 5-week series on Fauci. I did the one on testing and everything else that's going on, doing research and the new peer-reviewed publication that we have. Now, Trump should have fired him way back then. You shipped out a what? You shipped out a flawed test? Do you realize what you have done to the American public? Okay, I want your papers tomorrow. Okay, let's see what else this bullshit has to say.
Nevertheless, the president went on then from there to launch a series of attacks on the press, including the report in the New York Times this weekend on the many warnings that went unheeded before the administration, especially the president, began treating the outbreak as the threat it became. Maggie Haberman, one of the reporters on that story, which he called, quote, a total fake, joins us shortly. The president then introduced, I guess you could call it a campaign-style video. It had earmarks of a propaganda-style video. We're not going to show it to you because it's full of deceptive editing and taking statements out of context and is clearly designed to tout his administration's response and rewrite history of it. He followed that with more complaints.
Okay, so what Trump had in that timeline was a timeline in which he correctly reported the announcements that he made about shutting down people coming in from overseas, China, and so on. And you're going to see in a little while what the press did in real time. You know, if JFK set up an 8mm camera and projected a film on the screen, the press would have reported it. And every president from JFK all the way up until Ronald Reagan, Bill Clinton, Barack Obama, all of them, and George W. Bush, if they had shown a clip, that is the news. They are the president of the United States. Okay? And wait till you see what they did when during a live coverage of the news as it was happening, real historic events as it was happening. They just this is propaganda war, okay? 100% propaganda war. And we're going to get to that in a little while because it's not part of this clip, but it's part of another clip that I'm going to show you. Watch this.
And said if he'd acted sooner, 3 months sooner, is how he put it, quote, I would have been criticized for being way too early. That, of course, is an unknowable hypothetical. This, on the other hand, is how he did act and what he did say about the outbreak and how it evolved over time. Take a look.
By April, in theory, when it gets a little warmer, it miraculously goes away.
The coronavirus, which is, very well under control in our country. We have very few people with it. The people are getting better. They're all getting better. We're very close to a vaccine.
We're going down, not up. We're going very substantially down, not up. Of the 15 people, the original 15, as I call them, 8 of them have returned to their homes, to stay in their homes until fully recovered.
As a result of CDC's testing, okay? So everything that he's saying, he's 100% dependent on the CDC for his impression about what's going on. 100% dependent on it. Those people that went home, 8 of them went home, that's good news to him, of course. He's a businessman. He's not a scientist. Okay, so they were tested and they're ready to go home. How many were positive? How many were false positives? Right there. And look at the people behind them. None of them had the balls to stand up and say, Mr. President, we really, I'm sorry if we misinformed you, but we need to update you. Okay, so he's being manipulated. Absolutely. Now, can we get into Trump's head and say, well, this is an ego thing, and he's not going to admit ever that he might be manipulated by other people? He might, that he, or is he this type of person that wants to be the fearless leader and defend his team at all costs? Or does he just, has he been fooled, bamboozled? And knowing his business tactics and his approach to business, I think it's fair enough to say that when he wakes up and realizes exactly how badly he's been lied to, he's going to fire some people. I think there's no doubt about it. Let's continue.
A couple of days is going to be down to close to zero. That's a pretty good job we've done. It's going to disappear. One day it's like a miracle. It will disappear. And from our shores, it could get worse before it gets better. It could maybe go away. We'll see what happens. Nobody really knows. Anybody that needs a test gets a test. They're there. They have the tests. And the tests are beautiful. Anybody that needs a test gets a test. As of right now and yesterday, anybody that needs a test. That's the important thing. And the tests are all perfect. Like the letter was perfect. The transcription.
Yeah. Look at the CDC director. He wants to say something. This guy right here wants to say something, but he dare not speak up. But if we could maybe back this up a little bit, let's see if it works. Watch them all shake their head yes. Watch Azar and everybody else agree with Trump when he's talking about the test, which we knew at the time of this airing was flawed. Watch this. Oops, that's me. Hang on.
Nobody really knows. Anybody that needs a test gets a test. They're there. They have the tests. And the tests are beautiful. Anybody that needs a test gets a test. As of right now and
shaking his head.
Anybody that needs a test. That's the important thing. And the tests are all perfect. Like the letter was perfect. The transcription was
look
perfect,
look at this CDC guy. He doesn't speak up. He does not dare interrupt.
Pretty good. It will go away. Just stay calm. It will go away.
So with that on the table, and because the president has so much more to say, I want to go to CNN's chief White House correspondent, Jim Acosta. Jim, I'm not even sure where to begin with that briefing.
How serious Jim Acosta is.
Propaganda video touting the administration's response, or the campaign
style
video.
Oh my God, how terrible this is.
First of all, I'd like to hear your thoughts just overall in terms of all the statements, kind of stunning statements the president has made over time, how this ranks. Just overall, what did you think?
Yeah, Anderson, I think this was a total meltdown that the president had in that briefing earlier today. I've not seen him that off the rails since.
Total meltdown. President absolutely is reporting what he's been told by his people. And in reporting what he's been told, the press is spinning it as a total meltdown. Okay. And we've seen total meltdown before. The press loves to say Trump is having a meltdown in a press conference when he defends himself, when he goes, and I'm not defending President Trump. I don't want anybody to confuse what I'm doing here. Okay, I'm utterly apolitical. What I am is pissed off that CDC, HHS, and the press are playing fast and loose with reality to defend the CDC's reputation at all costs, no matter what happens to public health, no matter what happens to your job, your home, your security. That's what I'm doing. Okay, let's continue this bullshit.
He is backpedaling because he knows the same kind of scrutiny is on him now. He responded pretty angrily during that briefing because of these stories that have been coming out over the last 48 hours, calling into question his actions as this pandemic was building up and gaining momentum. One thing we should point out about that video, which looked straight out of Beijing or Pyongyang, there were White House officials who were working on that video this afternoon. So that video campaign-style video, propaganda video, whatever you want to call it, was paid for with your tax dollars. But the White House put that video out there to respond to the criticism that has been coming in over the last couple of days. And the president was asked about this during the briefing, whether or not he let too much time pass as he was offering all of these rosy projections about the coronavirus. And here's what he had to say.
What did you do with the time that you bought?
You know
the
we
month
did?
of February. That
We
video
did?
was a gap, right?
What do you do when you have no case in the whole United States?
You had cases
When
in February.
excuse me, you reported it. 0 cases, 0 deaths on January 17th.
Your video has a complete gap.
On January 30th.
What did your administration do in February with the time that your travel ban was?
A lot. And in fact, we'll give you a list. What we did, in fact, part of it was up there. We did a lot. Look. You know you're a fake. You know that. Your whole network, the way you cover it, is fake. And most of you, and not all of you, but the people are wise to you. That's why you have a lower approval rating than you've ever had before, times probably 3.
Okay, so what video are they talking about? Well, you don't know what video they're talking about because the press cut out, and I'm going to show you that in a minute. But President Trump had put together a timeline, had his team put together a timeline to show this is what we were doing. This female news reporter should have said, President Trump, we understand, because they know full well, we understand that in January 16th, CDC decided not to take the test from Germany. Was that decision run by you, or was that something that was made independent within the walls of the CDC? We understand that CDC then created a test and shipped it out, and it was flawed. And that's what was happening between January 16th and the end of February. CDC was fucking up on their testing. That's what was happening. Okay? They should have said, we understand that there was a whistleblower that came forward and said that people in the CDC lied to you, President Trump. Is there any validity to this? Do you know anything about that? No. What were you doing is what she was at. What were you as an individual doing? What was President Trump doing? And, okay, the press wants to use this outbreak and the status of the United States to bring down President Trump, to hurt his bid for re-election and so on. That matters to Trump. That matters to the press. Apparently, doesn't matter to me. What matters to me is what you're not being told about what was happening from January 16th until the end of February. What was happening from the end of January 16th to the end of February was that President Trump was being lied to. Let's drop Trump. The President of the United States was being lied to by CDC officials with lies that allowed the fake testing, the flawed testing to continue beyond the point of any reason, allowing the disease to spread, allowing the virus to spread and get out of control to the point where we have over a third of the cases of coronavirus, COVID-19 in the world. And New York has had more deaths than any other country. That's what was happening. Okay? And they're trying to tack it on him. And to the extent that he didn't fire people right away, okay, he owns it. It's never too late to ask for someone's resignation. Let's watch more of this crap.
You should point out that was Paul Reed with CBS News, who's a good reporter, Anderson.
Yeah, I mean, again, he goes to like ratings and approval numbers. Like that's a metric that matters when so many people are dying, and he's the president of the United States. The fact that he even focuses on, his ratings. The fact that
you're trying to blame the president of the United States for this when so many people are dying. Yeah, a good reporter would have asked about the cover-up, about the testing, would have asked about the whistleblower, Chris Meehan. Okay. That's what a good reporter would have done. So no, they're covering their own too. Let's see what more crap they have to sling here.
I mean, it's pathetic. It is fascinating. I mean, a lot of epidemiologists and others have talked about this lost month of February. The idea, the comment she was making and sort of the direction she was going in was, okay, you bought time with this alleged travel ban from China. It wasn't really a ban. Tens of thousands of people still came in on flights, but you allegedly bought some time. What did you do with that time in the month of February? And he couldn't answer it because that's a lost month, because he was holding meetings with Diamond and Silk, if that's what they're called, and, talking about.
Listen, Anderson. No, what was happening was he was being lied to during that period of time. He was being lied to. We've got this under control. Don't worry about it. Yeah, you should probably shut down travel, but you know what? The people that are coming in the airports, we're gonna screen them with our test. That's what was happening. He was told by his people that everything was fine. That's the lie. Okay? So wake up, Anderson. Wake up, Jim. Wake up the rest of you.
About magical disappearances in April.
Okay, let's look at that magical disappearances statement from a scientific standpoint. Why would the President of the United States believe that this thing would just magically go away? Well, because his handlers, or not his handlers, but his people at the CDC told him that when there's such an outbreak like this, Mr. President, here's what happens. We do contact tracing. We know who's been in contact with who. We have the systems in place. Those systems have been in place for years. This public health emergency response is all ready to go. Combined with the accurate testing that we have, that's the lie, what will happen is that this will kind of travel here and there. We'll get a few large outbreaks here and there, but mostly it's going to be under control because we have the accurate test. And so when will it go by? When will it go away? I can see President Trump saying, when will it go away? And they would have said, well, we can't really tell how it will go away. It'll just disappear. No big finish. It'll just disappear. I can totally see how if they had contact tracing and they thought that their test was accurate, but they knew that it wasn't, right? If they had an accurate test, I should say, that yeah, that's kind of what it looked like. It looks like it just goes away. Because you stop hearing reports in the news media. There's no more of this and there's no more of that. So, again, slather all the liability on President Trump, who is completely 100% dependent on what the CDC tells him, and he was being lied to in February. All right.
That's right, Anderson. And keep in mind, the president was trying to defend the actions that he took during that lost period. But his words are also important. Keep in mind, Anderson, and you know this all too well, half of the country is following his every word. There are governors in red states that were waiting to act because of what he was saying. And when the president of the United States is saying it's going to go away like a miracle, that this is just like the seasonal flu, and he is in an echo chamber with other people in conservative media, and this misinformation is reverberating back and forth, obviously that is going to influence policymakers outside of the federal government in states where those kinds of decisions are critical. And I think that is something that the president is he's trying to erase from everybody's memories. But propaganda videos and temper tantrums in the briefing room just won't do that, Anderson.
The president was also asked about Dr. Fauci and why he retweeted a Fire Fauci tweet. And I just want to play it because, again, his logic, there is no logic to it. Let's just play this.
Why did you fire Fauci?
I retweeted somebody.
Did you notice that when you retweeted?
Yeah, I notice everything. That's somebody's opinion. I was called about that.
Fauci are on the same page.
Yeah, we have been from the beginning. I don't know what it is exactly, but if I put somebody's opinion up, I don't mind controversy. I think controversy is a good thing, not a bad thing.
So, I mean, the idea that he just, retweeted somebody who says to fire his top scientist and he was aware of it, but it didn't mean anything, but he went ahead and did it. I mean, I would think a presidential use of time is more valuable than searching online for tweets like to fire the scientist if that's not what you, in fact, believe, or at least want to warn the scientist about and threaten him to start towing the line more.
That's absolutely right, Anderson. And keep in mind, last Friday, I pressed the president on this and whether or not he's going to tell his conservative allies to stop bashing Dr. Fauci and Dr. Birx, and he declined to take that opportunity. He said he had respect for them, but he declined to take that opportunity.
That's right. Why would he ever try to silence people from criticizing people who are so worthy of being criticized? I'm done with the CNN dynamic duo there. What I want to do is bring up the Today Show interview of the CDC director. And, CDC, everyone knows, unless you're under a rock somewhere, that I've been pushing for private in-home antibody testing so American citizens can know their own immunity status and their own active infection status so that they can make rational decisions as rational, productive citizens of these United States for some time. And I'm not going to be as critical of the CDC director as Fauci at this moment in time, because I haven't done a deep dive on his involvement in this, because Fauci's kind of taken the lead. Fauci's kind of like acting as the apologist for the CDC. And so the CDC director gets a bit of a bye. But this guy has an interesting background. He apparently was involved in some scandal with fraudulent science over an HIV. There's an investigation into his involvement in fraudulent science on an HIV vaccine. But nevertheless, let's take a look at how the CDC director is handling this, and I'll comment as we go into it. Hopefully there's no stupid commercial.
Joining us now, Dr. Robert Redfield, Director of the Centers for Disease Control and Prevention. Dr. Redfield, good morning. It's good to have you here.
Good morning. Thanks for having me.
We've talked about some of these encouraging signs where you're seeing new cases and hospitalization rates stabilize. Are you ready to say that we are at the peak, at the apex?
You know, I think, Savannah, we are nearing the peak right now. I think we'll sometime, hopefully this week, we will be able to say that, you know, you'll know when you're at the peak when the next day is actually less than the day before. But clearly the rate, we are stabilizing across the country right now in terms of the state of this outbreak.
Looking at
Okay, so I have a problem with that statement. You don't know you're near the peak when the number of cases starts to decline. You know you're near the peak, and you know you're at the peak when the effective R0 number has switched over to be less than 1, which is not the same thing. So as long as you can know a few days ahead of time whether or not you've reached the peak. As it slows down, it slows down, it slows down. And very simply, you can mathematically determine this. I use the ratio of the number of cases on day X compared to the number of cases from 5 days ago. Very simple. This guy's not an epidemiologist. I don't think he's ever done any studies that involve prediction modeling of any kind, but he's a CDC director responsible for all of our public health policies, apparently. Let's see what he has to say.
at the calendar, as I did this morning, I realized we have another 3 full work weeks of social distancing. The president has said he's hopeful the country could reopen May 1st. He said it's the hardest decision he's going to have to make. From a public health perspective, your lane, is it doable, conceivable that we could reopen the country on May 1st?
You know, I think it's important to look at the country as many different separate situations. This pandemic has affected different parts of the country differently. We're looking at the data very carefully, county by county by county, and we will be assessing that. Clearly, the things that need to happen for the reopening is what's happening with the numbers of new cases. We've got to substantially augment our public health capacity to do early case identification, isolation, and contact tracing, and obviously make sure we have the medical and hospital capacity, and really start working to rebuild confidence in the community so the community has confidence to reopen.
Do you feel we need to do widespread antibody testing? In other words, that blood test that shows if you've ever had COVID-19 or coronavirus? Because so many people, and I've seen studies that even say up to 50%, can be spreading the virus and never show any symptoms at all.
Yeah, in terms of active infection, there is a limit to the time that one is going to be infectious. And so that's the one test for the virus to see if you're actually infected. And we're going to need to have that aggressively employed as we begin to reopen. Because, again, central to the success of that, so we stay open, is to be able to do early case identification, isolation, and contact tracing, and to basically prevent the opportunity for community transmission to come back into the system.
Okay, wow. Jeez. Unlike we, managed to do in the first outbreak in the United States. We couldn't do this in the first breakout of the United States because we fucked up and we had a failed test. Tell the whole story. And how about the test now? I still have yet to see a sensitivity, specificity, pathogen specificity, accuracy statistics on the CDC's RT-PCR test, the one that they're allegedly validating, using to validate other tests that come out. I'm glad to see that he says, yes, antibody testing is going to obviously play a role, and that is going to be important. But I think people need to understand that what I'm advocating for, and very strongly, and I want everyone to look up, hashtag private means private when you're on Facebook, but find the IPAC website, get behind the IPAC Back to Work program, because although, he and Fauci would like to say, hey, it's a complex situation here. There's a big country. There's a lot of counties. There's a lot of differences between geographic areas. What if everybody in the United States could just go to their drugstore and go buy a $10 test if they wanted to? Okay? If they wanted to. Not that they have to, but if they did, then they could know if they are actively infected. And then they can act appropriately, whatever they determine appropriate is. And what if they turn out to already be immunized? Have immunity. If they already have immunity because they have the right antibodies for that, then why the hell are they still in lockdown? This is the most brain dead thing that we need in the United States right now. We don't need this contact tracing and everything else. The CDC had their shot. It messed up. Now he's talking about this la land future in which lockdown worked. Now we have the valid test. Now we're going to do contact tracing. Not with bullshit. I don't trust them. You shouldn't trust them. You should want to know your own status for your own purposes and make up your own mind about what you're going to do with that information. And if you care to report it, that's your business. If you have to get medical attention because if you feel like you're really getting sick and you might have double pneumonia, that kind of thing, they're going to test you again anyway. And when the CDC reports these statistics from RT-PCR testing, when the doctors report it, they report your gender, they report your zip code, and your age, and that's it. And your status. Okay? So all this issue about mandatory testing and Bill Gates screwing up the entire conversation with these bracelets and tattoos, these quantum dot bullshit tattoos, that's never going to wash in the United States. Our free and independent peoples are not going to line up like sheep, all right? And if they're trying to starve us out and not give us therapeutics and not do the right testing and not let us have the testing until we're desperate for a vaccine, that's terrorism, and they ought to be charged with terrorism. Now, let's go and listen to the CDC director again, see what more he has to add.
Antibody testing is going to give us a good idea from a surveillance point of view of how significant the outbreak was. And in certain circumstances, I think it will help bring consumer confidence in certain workforces, particularly some infrastructure workforces, where individuals will have greater confidence knowing they're already immune, particularly in the healthcare setting, to see which healthcare workers basically have been exposed and now may be able to care for patients without concern of infection.
All right, so that's bullshit right there. So good enough for them, good enough for us. Why should healthcare workers know their immunity status but not us? Well, because there's a huge boom of medical treatment and care that will draw more money into the healthcare system. Seriously, this is sick. This is absolutely sick. All right? To think, well, yes, antibody testing is going to be important in some sectors, especially for surveillance, he said. That's not me, that's him. Now, notice the difference. He wants antibody testing done by your doctor where there's reporting to the to the CDC. No, I don't. If it's good enough for your doctor, your nurse, anybody working at the hospital to know their immunity status, it's good enough for you. Okay? And there's some fantastic tests out there like Vibrant Technologies or whatever their name is out in California, I think. Vibrant, they've got an over 99% specific, 99% sensitive, 100% pathogen specificity, and really high observer variability, which means that if two people give the same test to the same group of people, they see the same thing. So, no, we need independent private testing. This is why I've been arguing for it. And if you have argued against independent private testing, saying no because they're going to twist this into surveillance, you're not getting what I'm saying. If you're saying, I'm not behind the IPAC Back to Work program because I should just be able to go out without a test, you're not getting what I'm saying. What I'm saying is you own that information. You should be able to have the information. The government can go screw itself on whether we give the information or not. And look at what they're going to do instead. Either if you don't get, and I hate to say it like this, but if you don't get behind the IPAC Back to Work program, surveillance of your immune system is coming. Okay? Government surveillance of whether you're immune or not is coming. Do you want that? No. Then call your senator, call your congressman, call both at the federal and state level, and demand in-home private antibody testing. Nobody has any business knowing whether a woman is pregnant or not, except for her. She pees on a stick, she gets the result. That's antibody testing. Okay? Private, in-home. I can't emphasize that enough. So compare me to what they want. Compare IPAC Back to Work to what they want. Please get behind the hashtag IPAC Back to Work with the 2. Let's go on.
One of the influential modelers or researcher at University of Washington talked about the dangers of reopening society prematurely. He said he's concerned about a second wave of infection actually in July or August. What's your take on that?
Well, there's no doubt that we have to reopen correctly. It's going to be a step-by-step gradual process. It's got to be data-driven. And as I said, I think it would be community by community, county by county.
Forget it.
We've all sacrificed a substantial amount, and I do want to thank the American people. As you've seen with the original models we had in terms of the potential mortality of this virus on our nation, it could have easily been, 250,000, 500,000, a million. I think the social distancing that the American people all embraced has really led to the reality that we see the overall mortality, while sadly still too high, was far less than we anticipated. So this has to be done very carefully.
Okay, so very carefully means the government has control over every little piece of information. No. I'm a lateral thinker. I can hear my son Ben, if he's watching right now, laughing because I've said this many times, but I think people need to understand I'm a creative lateral thinker, which means I can envision a future in which over the next 2 weeks, there's a ramp up of production of very accurate testing that goes out there for private consumption. And everybody gets their test that wants it, and everybody makes their decisions as they get their information. What is this long, drawn out, contact tracing, very scheduled? We're going to go county by county. You know what? Go home, CDC. You're drunk. Okay? That is not going to work. That's going to drag it out. There's going to be mistakes made. Baloney. Get out of my immune system. Get out of my bloodstream. I don't want you there. Okay? We need 100% testing for one person and one person only, and that's for ourselves. And when we do that, then we as rational individuals will make much better decisions than the CDC has made. Let me give you an example. Okay. Let's say that somebody has diabetes and there's a reported mortality risk of 6.3% if you have COVID-19. Their son was going to visit them and he was quarantined and self-isolated for 2 weeks. Good to go. He's going to drive up to Pittsburgh and he's going to visit. He decides, well, his boss tells him you got to come into work and you got to start working again. But the period of time that he was going to visit, that was a specific period of time on the calendar. And he calls his mom and says, you know what? I don't want to put you at risk. I'm not going to come visit because I may have picked it up at work and I don't know. Well, what does he do? On the way home from work, he could pick up a antibody test, go home, do a blood prick, test himself, know his status. If he's got an active infection, and he can buy 2, they're $10. He can drive all the way up from Texas if he wants to, and when he gets here, just before he opens the door, he can test himself again, right? And protect other people by not bringing it to Pittsburgh. Or let's say that there's a family where, the parents are isolated with their kids and the grandparents are over here. If everybody tests that they're already immune, then that family can start getting back together. The grandparents don't have to be isolated. If the virus is like every other virus that we've seen so far, which it arguably should be. We have every reason to expect that it should be. There are some alleged cases where a person gets reinfected, but if you read the articles and the instances closely, the articles actually argue against it being reinfection, but the title says reinfection. So there is a definite propaganda at work right now to make sure that this is dragged out as long as possible, to starve us to death until we're begging for a vaccine. Okay? We're begging for the government to know our immune status, and that's not going to happen. If you stand up right now, let's go back to what this guy has to say.
To look back once the crisis has passed. But the New York Times is reporting that you and Dr. Fauci were among those recommending mitigation, the social distancing, in late February. As we all know, the White House did not issue those guidelines until 3 weeks later, mid-March. And Dr. Fauci candidly said yesterday, look, we could have saved lives if it had started earlier. Do you agree with that?
I think it's important what you said. I think right now our job is to get through this outbreak and get our country back to work. I will say that if you look back in January and February, the cases we had in this country were all related to China travel. Actually, it was 14 cases throughout the country.
Right,
CDC evaluated over 800.
Okay, so here's the cases that we knew about were all related to China. If this disease was spreading in Wuhan in, say, December 1st, December 15th, December 10th, December 20th, there were hundreds of thousands of people that went back and forth from Wuhan and every other place on the planet. And China, okay? With a 4 to 5 day asymptomatic period, these cases may have resolved, very asymptomatic. Remember, there's a huge proportion of people that get this that are asymptomatic, and it's not serious. So he's saying these 15 cases were all related to Chinese travel. What about the 86% of the undetected cases at the time, which means maybe 200 or something cases? All right, so 200 cases total at the time. So if they had proper testing, then these 15 cases they're talking about would have stayed locked down. The Princess Cruise people would have stayed locked down. If they tested positive, they would have been quarantined, and the rest of us could have had more time to figure out what to do. But they didn't have proper testing because the CDC screwed up. Okay, here we go. But he's not saying that. Here we go.
Contacts of those individuals, and only identified 2 individuals that had been infected, both spouses. It wasn't until February 28th when we saw our first community transmission where we said, wait a minute, where's this coming from? And so I think it's important when we get back and we get through this, we can look back at the timeline. But our initial response was containment, and as I mentioned, through February 28th, I think we had 14 cases in the country, and that's when we got the first 2 community cases at the end of the month, and then began to institute broader mitigation.
Okay, so right there, okay, we're doing containment, which means that they were doing testing and contact tracing with a flawed test. Nowhere in this interview does he mention the flawed test. And watch further with my shock at the audacity that these people think that they're going to get away with this. They think that you don't know about the flawed test. Go to WWDNYK Studios. In fact, you know what? I'm just going to rebroadcast the entire episode at the end of this segment. I'll just let it play through. Go to WWDNYK Studios and find the first episode of Ending the Epidemic on Unbreaking Science, CDC's deadly testing fiasco. Do a watch party. Do a watch party on this one. Do a watch party 5 times this week on this one. They're not going to get away with this. Tell your senators that you know about the flawed testing and you want held people responsible for flawed testing because you're out of a job, because you can't feed your kids, whatever your gripe is, whatever's happening to you, make sure that the responsibility falls squarely on the shoulders of the CDC. 100% falls on the shoulders of the CDC. And he's on national news on the Today Show, and he doesn't mention the flawed test. It's unbelievable that they think that they can get away with this.
exploded between February 28th and then mid-March. I guess that just to put a fine point on it, if you can answer yes or no, whether you did recommend that social distancing in late February.
We had as February 28th, as we got into March, we recognized in different areas that the mitigation was now important. Seattle opened up mitigation. CDC sent recommendations to Washington, to California, to New York, and to Florida, recommending that they expand mitigation in those areas.
All right. Thank you, CDC Director Dr. Redfield. We really appreciate your time this morning.
Okay, so that was the CDC's response. And, you know, in being asked if they, does he agree in this context of the discussion that perhaps there was something more that could have been done that could have saved lives, they're seizing upon it, like they seize on everything, as an opportunity to try to slam Trump. And the press is politicizing this issue, playing fast and loose with the truth, fast and loose with reality. There's one more video that I want to play for you and analyze with you. This is, well, watch what happens. Watch what the press actually does during live broadcast news coverage of actual historical events as they're happening that you deserve to know. I'm not sure which news station covered this, but this was this is the Guardian at YouTube. But let's watch this and see what happens. Some way into this, you're going to see that they cut away from this this briefing.
Interesting. We have a few clips that we're just going to put up. We could turn the lights a little bit lower. I think you'll find them interesting, and then we'll answer some questions. I'll ask you some questions because you're so guilty, but forget it. But most importantly, we're going to get back onto the reason we're here, which is the success we're having. Okay? Please, you can put it on. Thank you.
How worried should Americans be about coronavirus?
Coronavirus is not going to cause a major issue in the United States.
Well, we've asked them to accelerate whatever they're doing in terms of a vaccine.
We are cutting into what was not a White House coronavirus task force briefing. I am Ari Melber. Our special coverage continues. We are going to avoid airing any more of this White House briefing until it returns to what it was supposed to be, which was the coronavirus task force providing medical information. What we just saw, I want to be very clear with viewers, was a video the White House put out which suggests they are spending their precious time right now making videos that defend the president's record and tenure rather than provide the much-needed emergency medical information that was promised.
I've never seen a video like that.
Okay, so here we are. We see the President of the United States offering information at the press briefing in response to reporters' incessant, repeated, dogging questions about whether or not this particular decision or that particular decision, or should you have started mitigation earlier? Did you listen to your experts and so on? He said, President Trump goes, I'm going to actually provide them with a timeline because these people really don't know what's going on. What does the press do? The press decides to cut away from the actual historical event at a White House press briefing. When President Trump says he even asked them to accelerate the vaccine to show that he hasn't ruled out a vaccine because it's their agenda to plug him as an anti-vaxxer, to use everything that they can possibly use against him politically. And again, I'm not getting involved in politics. I'm not defending President Trump. I am pissed to the hilt that CDC, HHS, to some extent, HHS, because NIAID falls underneath there, has not yet fired Fauci for his repeated prevarication, his repeated treating the testing fiasco like it's a nothing burger, okay? His repeated telling half-truths. And I am pissed to the hilt that they are manipulating your perception of reality, what you can see. The press is doing it. Fauci's doing it. To a lesser extent, the director of the CDC is doing it. But there are bad actors in this right now, and it's the people that made the bad decisions about testing. It's the people that allowed people who were positive with the virus to get out of quarantine, to not seek medical help, and so on, to fight against therapeutics. Okay, there's studies that are allegedly showing that have 60 people that are allegedly showing that there's some risk of hydroxychloroquine. Isn't that super convenient? We're going to run an underpowered study to show that a treatment that could provide an end to this outbreak before a vaccine is necessary. Well, of course, they're going to fight against it. Now, I want everybody to remember that I was among the first people that did modeling on this to say, what happens if we combine the effects of social distancing and therapeutics? And what I found, for the 100th time, I know I say it a lot, but what I found was that short, intense period of very intense lockdown, maybe 2 or 3 weeks, combined with a treatment that might be 60% effective, or treatment of 60%, prophylactic treatment of 60% of the population, we could be done with this in about 3 weeks and get us back to the point where we can do contact tracing and so on, where we can do mitigation. So, it's been a while. I don't know how long I've been live on this, but I hope that you see the difference between the government-sponsored programs to misinform you, the media to misinform you, to lead us inexorably down the path towards an immunization card or quantum tattoos, or maybe they'll tattoo our lips. They'll make us get a lip ring that you can scan or something, or nose ring. Why don't they just go for a nose ring? Okay, you could just scan somebody's nose ring with an RFID, and you go, hey, you know what? You're immunized. Okay, great. You're welcome to come in the club. You can work. You're welcome to shop in the store. You've got your nose ring on. Okay, that's what they want. What I want is for you to be able to get a $10 test, find out your status, and determine what you're going to do with your day. How about that? So to get behind this, go to IPAknowledge.org and look for this IPAC's denunciation and the CDC statement over our statement over the CDC's testing fiasco. Therein, there's a Google document and there's a spreadsheet. Download, share the links, whatever. Get it into everybody's hands. Demand in-home private testing. It is our only and last best hope before they say we're going to have to mandate a vaccine and you guys are going to have immunization cards. Papers, please. Papers, please. Let me see. So right now, I'm going to sign off, but I'm going to play the entirety of an hour and 45 minutes of Ending the Pandemic, CDC's Deadly Testing Fiasco in this video. So if you share this video, you get both videos. Do a watch party in a couple of hours. Make sure everybody sees this. They cannot let them get away with this crap. Dr. Jack signing out. Dr. Jack's got your back. Take it easy. I'll talk with you guys soon. Good afternoon, ladies and gentlemen. My name is Dr. James Lyons-Weiler. I'm coming to you live from the WWDNYK studios in Pittsburgh, Pennsylvania. This is a first in a 6-part series on ending the pandemic. Everyone knows what I'm talking about. I'd like everyone who has begun watching this to please tag 2 friends. This is probably one of the most important presentations that I've shared with the community, and we're going to sit back and relax. If you can't get through the whole thing, we might go 2 hours, we might go 3 hours. We'll see how long it takes to get through the material. But today, what I'm going to do is I'm going to go over CDC's deadly testing fiasco. And the way we're going to do this is by starting with where we stand today on the outbreak. At this point in time, today, we have 45,000 confirmed cases, and immediately The people who have been on top of things are thinking, how in the world are these 45,000 confirmed cases confirmed? And that's the topic of today's presentation. We have the CDC providing information compiled from all of the states. They have a laboratory response network partners in preparedness program, and this program brings forward information, coordinates testing, or is supposed to, for emerging pathogens, and it's very well funded. In fact, the CDC as a whole in 2018 had a budget of $11.9 billion. And one would suspect that an organization like the CDC, with the reputation that it has, with the authority that the CDC carries, that they would actually be on top of things when it comes to an outbreak. Unfortunately, as most of America should know, but probably doesn't yet know, and it's up to you to make sure everyone who can know comes to learn through this video, that America needed this coronavirus and that the government failed. I'm going to go into details, and I'm going to be reading articles to you, and I'm going to be playing videos as we go along. This is the Wall Street Journal publishing this. Scientists warn that we may need to live for social distancing for a year or more. It's not the kind of thing that Wall Street likes to hear. It's not the kind of thing that children who can't go to school and parents and people who like to get back to their jobs and who like to have their income, be able to pay their bills, would like to hear. And in America, in the United States, we're definitely focused right now on how soon we can end the epidemic. Well, I haven't even yet mentioned the people dying from this, and that's a sad thing. It's a sad thing to focus on the finances when in fact we have people dying, absolutely dying from the coronavirus. Now, I also know that there are people who are going to say, yes, but people die from many things. And I hope by the end of this presentation you're going to see that people are going to die unnecessarily, absolutely unnecessarily, as a result of one key decision, that we have to hold those decision makers accountable. We know from studies from China, like this one that was published in Science recently, that there is an asymptomatic period, and that asymptomatic individuals are responsible for the bulk of the transmission of this virus. This is what distinguishes it from every other virus, that respiratory virus that we've had to deal with. The asymptomatic period is estimated to be 4 to 5 days. And the Chinese study here also shows that 86% of cases were undetected by their surveillance. And you know what an information society China is, you know how they went into lockdown. Even with the lockdown, 86% of cases were undetected. And they did bring testing in the middle. So we have to take a look at what that means in terms of our numbers when we're told there's 45,000 cases. This is a chart from that study that shows that the impact of undocumented infections in the transmission of SARS coronavirus 2. And I happen to have had 2 conversations with 2 medical doctors who I respect, who say that they're treating coronavirus patients. And they say that they're not testing them because if they test them, their facility would be shut down. And so when we look at this rate of spread and what's happening, it is illegitimate to assume that simply because you don't have symptoms that you're good to go. You have to look at yourself as a person, a point person who could be the apex person that could lead to, I don't know, 100, 1,000, 10,000 down the road, maybe 1 million new coronavirus cases. And we'll get into the numbers of comparison to influenza later. It's an important comparison, and I'm going to outline for you why that comparison is so difficult. But if we correct for the estimated undetected using the 86% as a model. It's the only model that we have, unfortunately. The 45,000 cases that we see that are confirmed in the United States, they're presumed positive because they don't test for anything else, and yet they have all the symptoms required for a diagnosis of COVID-19. If we correct for 86,000, then right now, as of today, 3/24/2020, we're looking at something like 325,000 undetected, well, total detected and undetected cases in the United States. We'll get to the recovery in all of that and how that factors into what these numbers look like right now today. But for now, just understand that if there's 86% undetected, then we have a problem. And the nation right now is in virtual shutdown. State by state, they have varying degrees of shutting down the country to try to pause for a moment and say, what's our next step? How do we go from this situation where clearly we've gone on an exponential rise very early in the outbreak? We've went into an exponential rise. How did we get there so quickly? In my modeling, which I've done in the past for other outbreaks as well, I expected that since we were the United States and we did shut down borders and stop travel, and we do have the CDC, and that they would very easily develop a test. And testing is key early on in this. That we would have weeks and weeks of time. I was clamoring for not touching hands, not putting your hands above your head. I was clamoring for sanitation of public surfaces. And please, if you go out in public and you gas up your car, take some antiviral wipes with you and wipe down the buttons, and go around the other side of the pump and wipe down the other side of the buttons too. It's really a very filthy place when people are touching their hands and then they go through a drive-thru and grab some food. That's probably where a lot of the spread is coming from. But this 86%, if it's not 86% and you're skeptical, then what is it? We know that there's a percentage that are undetected. Let's say it's somewhere between 50 and 86% of cases that exist in the United States right now. So even at 50%, we're looking at something like 200,000, approaching 200,000 cases. When it comes to the comparison of influenza, this is made problematic by a number of factors. So if the COVID-19 real are those that are confirmed, and the COVID-19 real plus 86% not detected, and this was plotted a few days ago, that's why just a few days ago, you can see it's only 45,000. That was just a few days ago. And you see that the prediction came true. Now we're at 45,000, okay, that are starting to show symptoms. That's, first of all, a validation that there are many that were undetected because they hadn't yet developed symptoms. But among those that were undetected, they absolutely had many that would not go on to develop symptoms. 80% of cases are expected to be mild cases, and people might not attribute it to coronavirus. But on this chart, I also plot the real data tracked by CDC year after year on influenza A and B over the same time period, starting in October. So this is the first 45 days of the outbreak, and the influenza A and B are the first 45 days of the flu season. And there's an argument going on, or discussion, I should say, about is coronavirus just as bad or just as not as bad as the influenza, and that it's not a big deal, and that we're overhyping this, and that we maybe can all just go back to normal and not worry about this because it's not like influenza. Well, you'll see that this is a very difficult question to answer, and you'll see why. And you'll see what we have to do to try to start to be able to get to some answers as a result of us needing these kinds of data. It's a very, very important question. The public needs a frame of reference about what they're dealing with when it comes to outbreaks. So this is a news article from Fox that covered the 86% of all of the COVID-19 cases that before January 23rd that were not at the time detected by public health authorities. And it says that it doesn't mean that these cases were asymptomatic, but it means that some of them were asymptomatic and some weren't. But it's estimated that the undiagnosed cases infected 79% of the total cases. And that's what the study says. The study says that there's a huge, huge, huge number of transmissions from undiagnosed cases. And that means aggressive testing is very important, so that a person can be told that, yes, you do have the virus. Yes, you individually need to stay home. And that's incredibly important at the onset of an outbreak. As an outbreak proceeds, of course, then the testing becomes, if it's done very well, becomes essential in helping to shut things down. There's going to be cases that are not tested, but we'll see how essential testing is throughout this. Because in the medical resources that are projected to be needed under this exponential growth, under the worst case scenario and under the moderate scenario, there's 920,000 available hospital beds in the United States. Under a moderate outbreak, throughout the course of the outbreak, it's estimated that we'll need 1 million hospital beds. Under a severe outbreak, it's estimated that we might need 9.6 million hospital beds. That's 1,000-fold to what we have. In terms of intensive care units, in the United States, it's estimated that we have 68,000 intensive care units. Under the moderate outcome, and this is a study by Johns Hopkins University, under a moderate outbreak with coronavirus, we might need 200,000. Clearly, we don't have enough. Under severe, we might need 2.9 million intensive care units. I could go into the pathophysiology of the virus and tell you exactly what I think is happening in the lungs. I have a manuscript under review right now, a study that shows that in all likelihood this is a nefarious virus, specifically because it induces autoimmunity among multiple proteins, including some in our immune system. The ventilators that are at the most severe cases, where you need assistance breathing and oxygen support, there's 168,000 available. Under the moderate condition, moderate outcome, there's 740,000 that are needed. And we don't even want to know how many under the severe. So if we look at this exponential curve, it's just a curve. We've looked at exponential curves for, a couple of months now. I've been looking at it for 4 months. I've been tracking it since January, February, March. Well, 3 months. And in other countries, there's a lot of data resources out there, and they're very well done. And I encourage you to visit them and take a good look at what's happening in other countries. And I'm going to show you what's happening in other countries that do have testing. The estimated and detected being 300,000. The key question then becomes, what is the serious and critical illness rate? And there are apparently two forms of the virus. There's a slow form and a fast form. I call them the S and L genotypes out of China. And these two types of the virus, we don't know what percentage of people in the United States have the S form, and which type, and which percentage, or what percentage of people who are affected in the United States have the L form. We don't know which clusters involve the S form or the L form. And we're nowhere near that level of technical ability in the United States. And it's a serious problem, because we can't really predict, is this going to be 10%, 14% serious illness? Is this going to, that would be moderate to severe, 14% serious illness. And you saw the numbers under both of those assumptions. Is it going to be 6% need ICUs or 3%, 2%? We don't know. And, there's two ways to look at risk factors. One is to look at a risk factor and say, well, the risk factor explains it away. There are people that smoke, so I don't smoke, I don't have to worry. There are people who are old, and I'm not old, so I don't have to worry. There are people with diabetes, and I don't have diabetes. It's becoming increasingly difficult in the United States to say that. As something like 45% of Americans have metabolic syndrome. So there's the other way to look at it is, well, wait a minute. Yeah, a lot of people who died in other countries had pre-existing conditions, but almost everybody in the United States has a chronic illness now. Almost all of us have a chronic illness. So it does us no good in terms of what happens to the medical infrastructure to kind of wish away the reality and say, well, it's not of a risk to me because I'm healthy. I don't have to worry. God forbid in 2 months, somebody who thinks that they're healthy and they don't have to worry needs the intensive care unit because they were in a car accident. We're already at peak capacity in hospitals just every day. The hospitals are not overbuilt for capacity. And we have to take a good close look at what it really means, that it's not a worry because you're not at risk. You are made to be at risk if there are people in your life that have diabetes, or people in your life who smoke, or people in your life, right? Because you become a casualty yourself. Survivors of disasters are also casualties. So we have to take a good close look at being flip about this and saying we don't have to worry and be responsible and do our part. But what does that mean? Our society is grappling with it. China has dealt with it their way. Other countries have dealt with it. Hong Kong, Thailand, South Korea, Germany, because they have key information. We're left like children in the wind, in the wild, where we don't know which way to go because we don't have accurate testing. And I'm not the only one saying this. I'm going to actually read to you this Politico article. It was published on the 6th of March in 2020. It's written by Joanne Kennan. On Saturday, January 11th, the article begins a month and a half before the first COVID-19 case not linked to travel was diagnosed in the United States. Chinese scientists posted the genome of the mysterious new virus, and within a week, virologists in Berlin had produced the first diagnostic test for the disease. Within a week, January 16th, 17th. Soon after, researchers in other nations rolled out their own tests too, sometimes on different genetic targets. What they mean by genetic targets is that these tests, these PCR tests, make multiple copies of different genes. So if I design a test against the spike protein, I'll have one test. If you design a test against the N gene, N as in Nancy, you'll have another test. By the end of February, the World Health Organization had shipped tests to nearly 60 countries. The United States was not among them. By the end of February, we're in March, it's March 24th. Why the United States declined to use the World Health Organization test even temporarily as a bridge until the Centers for Disease Control and Prevention could produce its own test remains a perplexing question. And it goes on to say, and key to the Trump administration's failure, but you'll see that that's a political statement that it's not worthy of the ink that printed it. It's not worthy of the electrons pushing those letters onto my screen right now. The Trump administration's failure to provide enough tests to identify the coronavirus infections before they could be passed on, according to political interviews with dozens of viral disease experts, former officials, and some officials within the administration health agencies. Early on, the health agency officials that they're referencing tried to blame President Trump for the release of people from the cruise ships. We'll see that that's absolutely abjectly false. The slowing down of the testing regime, which administration officials acknowledged this week, the slowness of the testing regime, it wasn't slowness, it was an abject failure, is still not producing enough tests to meet the national demand. That was the first among sweeping of many failures. So far, there have been confirmed cases in at least 23 states. We now know that there's 50 and so on. Stock market plunge and so on. But neither the CDC nor the Corona Task Force, chaired by the Vice President Mike Pence, would say who made the decision to forego the WHO test, the World Health Organization test, and instead began a protracted process of producing an American test. It's not a protracted process to make this. The Germans showed us how easy it was. It's not complex. It's remarkably trivial and simple to make a PCR test. That's both sensitive, which I'll define later, and specific to the target. It was further delayed by manufacturing problems, possible ink contamination, and logistical delays. We're going to get into that in great detail. Senator Pat Murphy asked, please provide an explanation for why the COVID-19 diagnostic test approved by the World Health Organization was not used. And that was in a 3.5-page letter on the testing fiasco to Pence, CDC Director Robert Redfield, and the Food and Drug Administration Stephen Hahn. So far, none has been provided. We're going to get to the bottom of that. So, there's a quote from CDC Stephen Redd. We developed a test very rapidly after China produced the genetic sequence. We are in the process of validating that. All right, that was at the beginning of this month. And you'll see by the end of this presentation that we're nowhere near where we need to be. This was CDC Stephen Redd, a 30-year veteran of the agency, at a recent briefing. Azar, who initially led the White House, has now been sidelined by Pence, who also kept defending the testing regime. We've actually been progressing it on this, on par with our peer countries, he told reporters recently. This article is an older article. Okay. We have politics. At this time is when politics reigned. Reason was put to the side and politics reigned. Here is the test from Germany. This was the manuscript that the CDC downloaded. I'm sure they downloaded it or were given a preprint of it before it was published online. Berlin, January 17th, 2020. January 17th, 2020. There's a link to a peer-reviewed publication on this, and I've actually sent that to the FDA recently, and we're going to talk about my communications with the FDA about this. The Germans were so proficient at what they were doing that they actually provided the primer list on January 17th, a week later, and they also published the primer set. So our scientists had access to the exact primer probes that they could have used. This is a matter of email. Someone simply has to email this to all the manufacturers of tests in the United States and say, this is what we want you to use. But instead of adopting the German test on January 17th, the decision was made that CDC was going to make their own test, and further, through the emergency use authorization, once CDC acquired emergency use authorization, which I think was 3 days later, that was restricted to the CDC's test, and there was a delay before the FDA actually would allow other tests to be used. I'm going to read the abstract from the peer-reviewed publication published January 23rd by the German team in Eurosurveillance. And this is science at the speed of light. January, 2 months ago, January 23rd, my friends. The background, the ongoing outbreak of the recently emerged novel coronavirus, this is when it was called 2019 nCoV, poses a challenge for public health laboratories as virus isolates are unavailable, while there is growing evidence that the outbreak is more widespread than initially thought. And international spread through travelers does already occur. We aim to develop and deploy robust diagnostic methodology for use in public health laboratory settings without having virus material available. Methods. Here we present a validated, and that's the key word, validated. In diagnostics, validation is everything. If you haven't validated your diagnostic test, you don't have a diagnostic test. Here we present a validated diagnostic workflow for 2019 nCoV. It's designed relying on close genetic relatedness of 2019 nCoV with SARS coronaviruses, making use of synthetic nucleic acid technology. Results: the workflow reliably detects 2019 nCoV and further discriminates 2019 nCoV from SARS-CoV. Through coordination between academic and public laboratories, we confirmed assay exclusivity based on 219 original clinical specimens containing a full spectrum of human respiratory viruses. What they did there was they looked to see if their test would, by chance, be not specific to 2019 nCoV, or as we now call it, SARS-CoV-2. They looked to see if it would accidentally test positive for other viruses. The control materials made available through the European Virus Archive, a European Union infrastructure project. Conclusion, the present study demonstrates the enormous response capacity achieved through coordination of academic and public health laboratories in national and European research networks. So the Germans had it, the Germans tested it, the Germans shared it, they validated it. We could have had a test January 17th in production on January 18th. This is the specificity test, the numbers of samples that they tested for other viruses. It was very specific, highly, highly specific. This was a very accurate test. If we get down to the results in the paper itself, well, let's talk about their test. Their test amplifies the RDRP gene, it's the E gene, and the N gene. Let's look at the results. I'm just going to read this to you. They had determination of limits of detection of SARS coronavirus because they created samples of synthetic nucleotides that looked like SARS-CoV and that looked like the nCoV 2019 nCoV sequence. And they tested it to see if they could amplify it even though they didn't have viral sequences. The specificity testing we talked about, cross-reactivity with other coronaviruses. They mixed into negative human samples. They took the DNAs from other coronaviruses and they put them into, or RNAs, I should say, RNAs, not DNAs. And they had very, very high sensitivity, high specificity, no false positive outcomes. No false positive outcomes for the Germans on their test. Discussion. The present report describes the establishment of a diagnostic workflow for detection of an emerging virus in the absence of physical sources of viral genomic nucleic acid. You don't need a sample to do this. The relative ease with which the assays could be designed for this virus in contrast to SARS-CoV in 2003 proves the huge collective value of descriptive studies in disease ecology and viral genomic diversity. They could do what they did because people freely published their results in Science. Real-time RT-PCR is widely deployed in diagnostic virology. In the case of a public health emergency, proficient diagnostic laboratories can rely on this robust technology to establish new diagnostic tests within their routine services before pre-formulated assays become available. And so CDC wanted their own test. And in many ways, you'll see on the data that I'm going to present to you, this delay cost us everything. It led to the shutdown. It led to people being kept home from kids being home from school and people not being able to go to work. It led to the panic and the fear and what President Trump just mentioned. There might be more suicides from people losing their job. Please, if you have lost your job, call old contacts. We are a loving, caring species. Call old people that were used to be in their life and see if they have something that you could do for them working from home. Anything. Don't give up over this fiasco. If you need something, contact your local government and let them know that you can't feed your children. Don't let your children go hungry as a result of this. Don't go hungry yourself. If you need something, reach out on social media and just ask for it. Just ask, say, quarantine need, and make a request. No one's going to judge you. Please, let's take care of each other. It's very important for as long as we can. They wanted their own test, and then it turned out that some of the coronavirus kits that were shipped around the U.S. were flawed. This is February 13th now. So what happened here was that local laboratories were trying to use the test, and they found, because they had other tests that had been developed as well, that were not yet given the emergency use authorization, that they got different results. They got a positive result in patients that had a positive, diagnosis. based on symptoms and a negative result in the CDC's test. That's a false negative. Anthony Fauci is someone who's going to have to answer for a lot of this too, because in his explanations of the rollout, he did not sound the alarm and say, you know what, you're right, that's a real problem. We need to get that German test online right now. And that's something that could be said today, 3/24/2020. Is it going to be necessary? I don't know, because the United States is not doing science. The United States is doing authoritative decree, truth by authoritative decree. Anthony Fauci's non-explanations include, it was a technical glitch that slowed things down in the beginning. Nobody's fault. There wasn't any bad guys there. It just happened. We're going to get into this. In an interview with Science Magazine, the big picture question was, we've all had this pandemic preparedness. Why did this fail? What went wrong? Anthony Fauci wants us all to wait until it's over before we ask questions. I'm not going to wait. You shouldn't wait. And look back when we can still do something now to make this better. When we look back before we can answer that. It's almost like the fog of war. Fog of war. You see that? Don't let that into your brain. Stop that right there. Throw those words out. They don't belong in your brain. After the war is over, you then look back and say, wow, this plan, as great as it was, didn't quite work once they started throwing hand grenades at us. No, Dr. Fauci, this would be like Northrop Grumman giving us missiles that don't fire or worse, blow up when you mount them and arm them and kill our soldiers. It really is similar to that. No, it's not. Obviously, testing for the new coronavirus is one clear issue that needs to be relooked at. Okay, we're going to do that today. We're going to do this today, and we're going to look at it all week. Because everybody watching this video, I want you to share this with your elected representatives at the state level. I want you to share it with your elected representatives at the federal level. And I want you to share it with your medical doctors. I want you to share it with your loved ones and your family. Why were we not able to mobilize on a broader scale? But I don't think we could do that right now. I think it's premature. We really need to look forward. Really? In an interview with Hugh Hewitt on 3/17, this is not too long ago, Anthony Fauci was asked the question, what's going on with the test? He said, you know, it was a complicated series of multiple things that conflated, that just, you know, went the wrong way. One of them was the technical glitch that slowed things down in the beginning. Nobody's fault. There wasn't any bad guys there. It just happened. Hugh Hewitt, go read the entire thing. And you can listen to the audio too, I think. And then when the CDC realized, when the CDC was told, and the FDA said both the system itself as it was set up, which serves certain circumstances very well. I don't know what that means. Why put in it serves certain circumstances very well? Okay, it doesn't. Certain circumstances, these are vague non-answers, was not well suited to the kind of broad testing that we needed the private sector to get involved in. The regulatory constraints, which if there were none, which under certain circumstances are helpful in protecting the American public, were not suited to the emergence of this particular outbreak. What are you talking about, Dr. Fauci? The CDC was given the first emergency use authorization. How long did that take? A day? You going to blame this on the FDA for saying yes? So there was a confluence of a bunch of things. This is a non-answer. I believe now that the CDC and the FDA and the department, and that we've got it right now, because we're handling much of it over to the private sector, to heavy hitter companies that do this for a living. Do this for a living? Every person at the CDC involved in diagnostic does this for a living. The people who made the decision to make this test in the CDC first, instead of adopting the German test, they're going to cash their paycheck from that month. And they're making a living working at the CDC. So don't give me this because they do that for a living. And I think what you're going to be seeing looking forward is a major, major improvement to the availability of testing. Availability of testing is one thing, Dr. Fauci. Accuracy, sensitivity, and specificity are another. We're going to get to that too. Hugh Hewitt, was the glitch or anything about the production of the test President Trump's fault? Or actually, let me put it more broadly, would every president have run into the same problem? Anthony Fauci, oh, absolutely, this has nothing to do with anybody's fault, certainly not the president's fault. Unfortunately, there's a brave soul out there who stepped forward about the reality of what happened. There's a whistleblower, and this was an exclusive interview with James Rosen, Sinclair investigative reporter, and this was published Friday, March 20th, 2020. I'm going to read this to you. As the coronavirus spread to all 50 states over the last 2 months, right? The date again, March 20th, 2020. As the coronavirus spread to all 50 states over the last 2 months, the Trump administration faced mounting criticism for the lack of reliable, widely accessible test kits. Now, a former senior federal health official nominated to his post by President Trump alleges that the delays in testing occurred because leaders at the Centers for Disease Control, quote, lied, unquote, to the president, and that the Health and Human Services Secretary Alex Azar and to Health and Human Services Secretary Alex Azar about the center's ability to produce the kits. And so what this person is saying, this name is Chris Meehan, the former Assistant Secretary of Health and Human Services, in making these allegations for preparedness and response, decided private discussions he has held in recent weeks with top federal officials and physicians and scientists employed in private sector industries that are active in the anti-coronavirus efforts. Meekins described his contacts on the White House Corona Task Force as, quote, friends, some of whom he has known for years. From my conversations with members of the task force, this is Chris Meehan's quote, both inside and outside the administrations, Meehan told Sinclair's in an exclusive interview, the U.S. government, from Secretary Azar to the president, relied on the Centers for Disease Control to produce a test. They failed. CDC said they would handle it. What we have found out is that these leaders at the CDC lied both to the HHS secretary and by extension to the president. And as a result, the nation got weeks behind. He didn't say days, weeks, critical weeks behind. CDC has acknowledged that its initial stab at mass production of the test kits, we do stabs at mass productions, we just take we're going to try, encountered, quote, a problem, and that federal deployment of safe testing equipment lagged as a result. Safe testing equipment? No. The center's initial test kit carried the formal name Center for Disease Control and Prevention, CDC 2019 Novel Coronavirus 2019 nCoV Real-Time Reverse Transcriptase RT-PCR Diagnostic Panel. Okay, so that's very specific. And on February 3rd, CDC invoked public health emergency laws to petition Food and Drug Administration to allow medical professionals to make use of unapproved medical and diagnostic products that included these test kits. Okay, we're under an emergency situation. We're going to break the rules. We're not going to follow regulatory procedures. And yet, we just heard Tony Fauci tell us the regulators, the regulatory red tape got in the way. FDA issued its approval the next day. With that green light, especially the CDC, the International Reagent Resource, IRR, began shipping off the test kits. Shortly thereafter, CDC later disclosed laboratories started noticing performance issues with the test kits, and that the end result of laboratory personnel is, quote, not being able to verify the test performance. The core issue is said to be a defect in the manufacturing of one of the reagents, the center said. CDC is remanufacturing the reagents with more robust quality control measures. No, they're not. What they're doing is they're saying, use the test kit as we shipped it. Now, this isn't Meehan saying that. This is a CDC quote. The center's website noted. CDC is remanufacturing the reagents with more robust quality control measures. What they're saying is that we had 3 genes that tested. You're supposed to use 2 out of 3. Just use 2 because the third one's broken. The center's website noted, along adding that new tests would be distributed once this issue has been addressed. Okay, then Dr. Anthony Fauci, head of the National Institutes of Allergy and Infectious Diseases at the National Institute of Health, Widely regarded as the most experienced and respected expert serving on the president's coronavirus task force, said post blank in a January 31 briefing, quote, "We don't know the accuracy of this test." Commenting on the availability of test kits for other viruses that are confirmed to be 100% accurate, Fauci lamented, "That's not even near what we have right now for the coronavirus." Well, we can say Fauci told CBS News Face the Nation last Sunday, that's not this last Sunday, but the Sunday of that week, is that, quote, "Now we have the private sector involved, we're going to see an entirely different scene that we've seen weeks previously for sure." Now, that article goes on with the CDC saying that 89 public health labs in 50 states are using the COVID-19 test. I'm not sure that's a source of reassurance to me. CDC rapidly developed a diagnostic test for CDC and the nation's public health labs, the statement said. No, they didn't. They developed a flawed diagnostic test. So what was wrong with CDC's test? Well, the first false negative that was attributed to a specimen that was mislabeled. There was a person that was released from Princess Cruise Line who later went on to develop a COVID-19 case. We were told that by the CDC that it was a specimen mislabeling. And then when labs started saying, wait a minute, your test is flawed, it turned out that one of the 3 genes didn't reproducibly amplify and they couldn't validate it. They got 2 sometimes, they got 1 sometimes, but they never got 3 out of 3. And so they started looking at other tests that were easy to develop. As you can see, you can make a test in a day. The question is whether or not are you a scientist? Are you going to validate it like the Germans did? And in making the comparison between these tests and that are not, approved tests, okay, they came up with different results. The RNA extraction kit turned out to be a limiting factor, we're told, which sounds patently ridiculous because we really at the time only had hundreds. We only had hundreds of cases when the problem was being rolled out. But in these kinds of rollouts, there can be a limiting factor. There definitely can be an unanticipated limiting factor. So I'll agree that RNA extraction is a very important part of this testing because you have to basically turn the RNA, pull the RNA out of human tissue, like a swab, cheek swab, feces, whatever you're testing. You pull that RNA out, then you have to do reverse transcription to it, and that extraction is essential. But all the parts of the kit are essential, so you would think that in the emergency preparedness of a pandemic, they would expect that there might be an RNA virus. We certainly heard a lot about RNA viruses. We had experience about RNA virus. We had SARS in 2003. $11.9 billion a year? Almost $12 billion a year. The CDC wanted to market a test. They wanted to be the main player. They wanted to market a test, have hospitals use it, have companies use it. They could get it. They do licensed technology. We're going to get into that, but more importantly, they want to be seen as the authority that validates everybody else's stuff. Okay? They want to be the bottom line gold standard. They should have validated their own stuff first. But I heard also that they wanted to market a test that tested SARS, MERS, and SARS-CoV-2, and that would make it very complicated. So there must have been some discussions, or maybe that affected the way they chose their primer sets. I don't know. I've analyzed the primer sets, and I'm going to tell you what the results of that were. But there certainly are, by definition, an insufficient number of tests if you leave it in the hands of CDC. There's an insufficient amount of creativity and thought going into it because you have a limited number of people working on the problem. And if we know anything from 1985 going forward, is that massively parallel processing of a computational problem, and this is a computational problem at this time, this diagnostics, it's solved by including many players, not by having all of your eggs in one basket. And then there's the problem of false negatives. There's a coronavirus patient that was released in San Antonio on March 1st. Later turned up positive for infection. Why were they released? Well, there were 122 of them that were released, and some of them were false negatives on the CDC's test. Grand Princess Cruise disembarked all passengers, relocating, and they relocated them after the coronavirus cases. 3,500 were released. Unbelievably, they planned to drop the passengers off at a mall. And it wasn't until local authorities said, we don't want your 3,500 coronavirus cases. We want them to go somewhere else. So they put them on a military base. Well, okay. Why? Now, I understand that it's important not to let people get sick if you can prevent it. I understand that individuals have rights. And I'm a firm believer and fighter for individual rights. But at the same time, while those patients were on that ship, I very loudly suggested that all cruise ships be transformed into field hospitals, and that basically $1 billion be used to transform them into the world's most exquisite hospitals. But I'm just one guy, right? The availability of the test is a problem too. Here's a statement by a quarantine nurse from a Northern California Kaiser facility on March 5th, 2020. As a nurse, I'm very concerned that not enough being done to stop the spread of the coronavirus. I'm currently sick and in quarantine after caring for a patient who tested positive. I'm waiting for, quote, permission from the federal government to allow for my testing, even after my physician and county health professional ordered it. At this time, March 5th, 2020, there were people in the healthcare industry who could not be tested because they needed permission from the federal government. Now, here we have Daniel Newman. He's an actor. The show was Walking Dead. Says struggles to get a coronavirus test. In reality, okay, if I can get this to play for us. I also want to notice that they see it says World Health Organization warns against using untested drugs. That's not what the story is about. The story is about Daniel Newman, the Walking Dead actor, struggling to get a coronavirus test. Okay, see, these two should be swapped. A little feedback there on perception control. Okay, and let me see if I can pull this up and hopefully it plays.
Have you considered how you would like
Sorry
to be
about the ad,
remembered?
folks.
Your funeral may be decades away, but planning your burial now is a great idea.
It's a very, very unfortunate
and financial burden of planning
commercial.
Your funeral. Visit burialplanning.com to get
Very,
our free
very
burial
unfortunate. I'm
planning
sorry
guide.
about that.
I really was not concerned initially. You know, I just had a cough. And then I started to have a little bit of trouble breathing, and it just progressed, but it still it felt like a cold or a flu. So it didn't really hit me until I'd heard that, somebody in the group had tested positive. And so I immediately, like anyone, you start thinking, like, how many people have I just shook hands with? We just did Mardi Gras with thousands of people, and Sam Smith and Dua Lipa, and like, what in the world do I have? And just to be responsible, I started calling I called my doctor. He didn't have the test. I called the urgent cares all over Georgia. Nobody had the test. Then they forwarded me to the health department, and the health department basically said, just keep calling around. And it wasn't until I was able to find this one giant hospital in Atlanta emergency room. They went through all of the questions and asking me everything to kind of make sure that it was a fit. And then they were like, come in immediately. And when I got there, they took the temperature and all the vitals, and they were like, yeah, we have to test you. So $9,000 later, they were letting me know we need the ER beds, and your symptoms are super mild. So the government has told us we are not even allowed to process your tests. And so they just let me and lots of other elderly and young people go home to self-quarantine without even being able to process the test.
You were at one point nearly just turned away entirely, right? Until someone recognized you from your role on The Walking Dead?
I mean, that's disgusting. Yeah. At the entrance, they had a tent, and they basically were telling everybody after taking temperatures, you probably have a cold, You probably have a flu, just go home, self-quarantine. And yeah, it wasn't until, and preferential treatment is disgusting. The fact that our healthcare system is turning everyone away. And then even after I got tested and had this huge bill, they still couldn't process the results.
Okay, so let's dispense with that. And so there's not enough tests as well. And they start off all gung-ho and they want to do the testing and be ready to do testing. And instead of being able to do testing, they find out that there's not enough, so now they have to triage. They have to triage and prioritize people, and this is the beginning of what could turn out to be a very ugly situation in the United States, where people are being turned away from the hospitals that have deadly conditions and they need emergency care. They have deadly conditions, they need intensive care units. This is not a hypothetical, but it starts with the testing availability not being there, increasing the numbers, because we're going to get into the reason why we have to have accurate testing. There's both specific and sensitive issues about specifically testing this virus and getting a true positive and not getting a false positive, and sensitivity, which is being able to detect it when it's there and not getting a false negative. So when we look at other people like Dr. Messonnier and what she's had to say about this, I want to share this with you. The reporter, this was a transcript of an update by the CDC. You talk about the case count being low. How do we reconcile that with the fact that here in California, the most populous state, the governor yesterday said only a couple of hundred testing kits? And this is the core issue. How do you know the number of cases if you're not testing? The case count will be low because it sounds like there are enough tests that could reflect it. It seems like the issue of the math seems to be on a low count. Dr. Messonnier, that implies a false negative rate. Yes, thank you for the opportunity to talk about that. We need to remember that this situation is taking place rapidly. Another non-answer from a CDC official. By far, the majority of cases have been in California. A few weeks ago, we found an increase in cases around the world. Not relevant. She's buying time in this answer. She's on a conference call. And again this week, as we have seen an increase in cases globally, stating the obvious. Because of the aggressive U.S. efforts at the border strategy, a number of cases have been low. And we have been able to focus our efforts on travelers and their close contact based on our evaluation of who is at highest risk. No, you have not. You have not been able to track anyone that during a 4-day asymptomatic period. There are thousands and thousands of people that are interacting all the time, every day, every week, that had this virus because they were let go, because they tested negative on your blood test. And we have been able to focus on efforts on travelers and their close contact based on our evaluation of who is at highest risk. We will continue to modify our approach, sure. In terms of diagnostic testing, additional labs are coming online with additional test kits are on their way now. And the very next question, there's more problems with the responses and the non-responses. Hang on, a little technical glitch here. The reporter asks, I think a lot of us are grappling with a little bit here is the idea that China has been able to do tens of thousands of tests. Korea has been able to do thousands of tests, and here in the United States, in our local, we have done about 500, and our local patients are then plus another 2,000 patients or so have been repatriated. We just don't have the numbers they do in terms of numbers of tests. Can you explain that to us? How are others able to do thousands and thousands of tests that we have not been able to do them yet. Messonnier replies, I think there are two answers to that question. One is that the epidemiologic situation in China and other countries is really different from the United States. And people breathe in China, and they shake hands, and they go to work, and they shop in stores, they travel in taxis, they make love to each other, they hug their children, they go to school, they go to work. I don't know what she's talking about. We acted incredibly quickly before most other countries. Really? That's an absolute lie. Aggressively controlled our border, and we were able to slow the spread in the United States. That was an intentional U.S. strategy, the goal of allowing us to control our efforts. So we have focused surveillance on those at the highest risk again. So, we're looking at non-answers here from Dr. Messonnier. It's consistent with a pattern of really not being able to answer and give real answers. I have real answers, and I'm going to share them. This is, discussing scenario. This is the official CDC update, and we're getting these broad brush answers. They really don't mean anything. Our solution is part of, and is a huge priority in HHS leadership right now. Okay, but our solution, a larger part of any such infectious disease, is getting the test kit out. Really? Okay. We're gonna review if the CDC should be getting test kits out at all in the future. CDC has always had the capacity to test from the time rapidly when the sequence was available. And that there are two labs at the CDC doing the testing, and we have been testing aggressively the patients that state health departments have referred to us. I'm sorry about the choppy reading, but the print on my screen is very, very small, so I had to amplify it. But so misinformation, incorrect information. The capacity of a lab to run a test has nothing to do with the accuracy of the test. The utility of the test is determined about whether or not you did science to actually validate the test. Now, February 29th, the FDA allowed local labs to develop tests, and if anyone at the FDA is working on this, then you're going to tell me there's a different story, that you never had a problem with other people submitting emergency use authorizations. But that's the way that this looks, that there was a priority to give the CDC a chance to get their test online first so that they could be the lab that validates other people's tests. And that's ridiculous. That's patently absurd. And it's the weakest link in the chain. That whole setup is the weakest link in the chain. It doesn't take a CDC to validate an RT-PCR test. It's ridiculous. Absolutely, patently ridiculous. The Germans did it with a network. The Germans did it with a collaboration of different labs, okay? And that's the way that it should be. The New York Times on March 17th, this is not that long ago, today's the 24th, the U.S. lags in coronavirus testing after slow response to an outbreak. So here is the CDC's massive effort to test, okay? These are the number of tests and the number of cases. These are the number of tests and the number of cases in Italy. Italy's adopted the Germans' test, and they're all over it, but they still have high mortality. I can't imagine what Italy's mortality would be like if they didn't test. And here's South Korea, the winningest of the winning. Look at South Korea. That's what we want to look like right there. The number of cases came, and the number of cases went. And look at the massive amount of testing. All right? Far, far, far more testing. Far, far, far more testing than cases, and that's a direct result. Because they're testing so much, then they can isolate people and shut down the number of cases. Because they're testing so much, there are few cases and therefore less mortality. Because they're testing so much, we don't see an exponential increase like we're still experiencing here in the United States. This is data from virusncov.com. It looks like and in the United States. I'm going to compare now the United States and South Korea. These charts are nice because they plot the active cases and the recovered cases and the deaths. And that's just beautiful because it breaks it down so we can understand. Here's 50,000 active cases as of today for this data resource, about 50,000. The recovered cases, I don't see any recovered cases. I don't see any data on recovered cases. I don't see any data on deaths. Okay, but the scale, that's the scale that we have. There's so many cases, all right? And that's good. I don't want to see any deaths. I want to see recoveries, though. So where are the recoveries and where are the deaths? Right? That's a matter of scale. I'm sure if we zoom in, we would see more. This is what South Korea looks like as a result of testing. They peaked somewhere around 7,900 active cases, and then they bent the curve. And that's what it means to bend the curve down right here. And look at the number of recovered and the low number of deaths. Okay? This because they started testing right away. That's March 1st for them. All right? And March 1st for us was way back here. So we're looking at a totally different scale. If you did the logarithmic scale, you're talking 45,000 versus 4,000, 8,000. Okay? So, yeah, we're simply not doing proper effort here. And it's the lag is one thing. But there's other concerns about these tests we're going to get into. Like the coronavirus false test results. With the push to screen comes questions of accuracy. Reports of false negatives could complicate efforts. And that's the Mercury Times. Let's see. Well, one of the things that everyone should realize is that Dr. Wen Lang developed a cough and fever because he treated an infected patient. And he tested in China negative several times before eventually getting a positive result. And there's a quote here from Medication Junction. I want to give proper credit to it. Sorry about the mismatch about what's on. Well, let me bring that up. I want to go to this first. Okay. Are coronavirus tests accurate? On January 30th, the doctor posted, today nucleic acid testing came back with a positive result. The dust has settled. Finally diagnosed, according to the BBC. Dr. Wen Ling passed away on February 7th to Wuhan, the epicenter of the outbreak. No longer the epicenter, Europe. The next paragraph is very important in this article. False negative test results, where patients are told they do not have a condition when they actually do, cause several problems. Patients may be turned away from hospitals and medical facilities or cruise ships when they require care. They may infect others at home, work, school, or in the community. Patients' conditions may also worsen without treatment, and that is key. The reason we're being denied treatment for people that otherwise, if there's false negatives in this test, then we have a serious problem. In the test that's being used right now, we still would have a very serious problem. Okay, so and this is not anything that's new. We've known about false positives and false negatives in molecular diagnostics and other diagnostics for decades and decades and decades. The evaluation of a clinical test is very important. So this coronavirus false tests, the push to screen comes questions of accuracy from mercurynews.com. For a month, Rick Wright's life has been in limbo. More than a dozen times, the Redwood City man has been tested for coronavirus, and yet the results swing back and forth, never assuring them that he is or is not harboring the virus. I'm sitting in a holding pattern, said Wright, who never felt sick after being evacuated from the Diamond Princess cruise ship in Japan last month, but was quarantined at a San Francisco hospital for 8 days and then came home to protect his family and community. You're happy one day, then sad the next. You just want to be cleared and get your life back. He's not alone in this mystery. As testing increases, so do reports of inconclusive test results. And then I don't know where the next sentence comes from. In general, the test for COVID-19 is very reliable, especially in people with symptoms. I don't know what that means. What that is, like a confirmation bias. If you have symptoms and you get a positive, oh, okay, does that mean the test is reliable? No, that's only half the equation. Actually, it's technically 1/4 of the equation. Because as the article goes on, the specter of so-called false negatives, of wrongly telling people they're free of the virus when they are actually infected, looms menacingly over the effort to detect and control the disease as quickly as possible. Last Saturday, after testing negative, a Stanford student left campus by car and 5 other students, but on Sunday he learned that he tested positive, according to the Stanford Daily. I want to give you guys the dates. I want to emphasize the date of this. The date of this report, so I don't mislead anyone. Published March 19th, 5 days ago. So these people that are testing negative, testing positive, they're the ones that are, you know, walking around feeling like they're that they're negative. The ones that are negative, that they're infecting people because they're told that they're negative. Okay. In its official rules for testing, Santa Clara County Department of Public Health notes, quote, "It is important to note that the test is not validated for use in asymptomatic individuals, and testing those without symptoms may give falsely reassuring negative results and lead to missed infections and inaccurate safety recommendations. The U.S. Centers for Disease Control and Prevention has not disclosed, 5 days ago, people, how sensitive its test is to detect very low levels of the virus. The Germans did. The Germans published that. The Germans published that, and the Germans taught the world how to publish that. When Dr. Anthony Fauci, the director of the NIAID, was asked about it in a recent interview in the Journal of American Medical Association, he hedged, quote, "If the test is positive, you absolutely can make a decision." That's not another non-answer from Dr. Fauci. Okay. So you can look up that Mercury article and read the rest of it yourself. Let's look at the Centers for Disease Control and Prevention. Let's look at their website. On Monday, February 3, 2020, CDC submitted an emergency use authorization package to the U.S. Food and Drug Administration in order to expedite FDA-permitted use of the CDC diagnostic panel. They're going through some definitions of the EAU process. FDA issued the EAU the next day. IRR began distributing the test kits to the states, but shortly thereafter, performance issues were identified related to a problem in manufacturing one of the reagents. We talked about that. CDC is remanufacturing the reagents with more robust quality control measures. And the next sentence. I'm accessing this website live, and I'm reading it to you live right now today. Excuse me. CDC continues to perform initial and confirmatory testing. They're using an untested test. The original CDC test has not yet been validated. New tests will be distributed once this issue has been addressed. CDC continues to perform initial and confirmatory testing. You guys are not going to believe what's coming next. What's coming next is the protocol for, how we're going to validate this. Here, go back one. And if I can scroll, I don't know if this is going to let me. No, it's a slide. I can't scroll. Later on in the website, it says serology test for COVID-19. There are serology tests, and we're going to talk about it. The serology tests at the CDC, well, there's commercially available serology tests. Antibody tests, we're going to talk about that. Antibodies detected by such tests indicate that a person had an immune response to SARS-CoV-2, whether symptoms developed from infection or the infection was asymptomatic. And yet, here's the reality. If you're a commercially available entity, if you're a company and you have a serology test, you have to submit the results of that test along with samples to the CDC for validation with their unvalidated PCR test. That's in the United States today, 3/24/2020. My contention is that the CDC is not ready for any major outbreak whatsoever. We're going to take a look at what they did with Ebola and what they do right now with Ebola. Here's what a person has to go through with a clinical sample if they suspect Ebola virus. They have to have the infectious substance in a vial that's capped with absorbent packing material. It has to be wrapped in one container, put in another container with a lid, and put in a box. All right, and it has to be shipped like this. That's fine if you have one sample. Most laboratories can do that with one sample, but in an outbreak where you have hundreds of samples or thousands of samples, All of the labs around the country are busy packing up their samples instead of doing local testing. If you have thousands, what about 10,000 samples? Is CDC capable of handling 10,000 samples? No, they're not even capable of tying their own shoes. They can't put a test together. High school students can put RT-PCR tests together in the lab. I'm sure of it. If you go and you look at the guidance for the collection, transport, submission of specimens to Ebola virus testing, why in the world are we sending samples to the CDC for validation? That's why we're doing it. Because you may have a perfectly good molecular biology lab or a BSL-4. Okay, fine, it's a BSL-4. We've got to take care of it. We've got to make sure that nobody gets sick. It's Ebola, for crying out loud. But what if the CDC's test for Ebola is as good as their test for coronavirus? And all that handling and packaging and wrapping, and you're already in the room with the person sitting right next to you that might have Ebola. Specimens should be obtained when a patient meets the criteria for person under investigation, PUI, including patients with clinical signs, symptoms, and epidemiological risk factors for Ebola virus disease. I have a history with the CDC on Ebola testing. I was the director of the Ebola Rapid Assay Development Consortium, managing director. I'm a humble person, so I made myself managing director to try to help make it happen. In 2014, 2015, I was working with 3 universities who all agreed to work with me at the onset of my non-academic career as a free and independent scientist. And we were designing, using computer models, proteins that would bind to the Ebola surface antigen, surface protein. And this test was a colorimetric test that would wick saliva into a jar. So the protocol for laboratory screening would be a person wearing gloves doing laboratory screening would hand the jar, a small vial, to each person coming off the plane, or the airlines could give them to them. They could be in the test could be distributed on the plane, and the individuals could be instructed to put it in their mouth for 15 seconds and wick saliva, and then put the vial into a plastic bag, seal it, put it into another plastic bag and seal that, and then hand it to whoever they're supposed to hand it to when they disembarked. The vials would then be gone through before anybody could leave, and the ones that turned pink, those would be the ones that would retain as persons under interest. Now, I called the CDC because we were going to be close to a prototype. And the prototype, we couldn't test it because we don't have a BSL-4 laboratory. So I asked CDC, would they test our prototype, and they said no. It was an outright rejection. And I said, why? I told them who I was working with: UC Santa Barbara, UIUC, University of Illinois Urbana-Champaign, Penn State University. I was working with some major hitters here. Stanford, I think, was involved for a little bit. And their answer was no. And I said, why? They said, well, because we have our own RT-PCR kit. And I said to this man, whose name was Stuart Nickel, I had read his research papers, and I knew the viremia in the body, when the viremia is higher with a large viral load, that the Ebola virus was present in saliva. I said, but for PCR, you're doing a blood draw, right? He said, yes. I said, you're going to do blood draws in the airport for airport screening. And he said, I'm sorry, we're not going to test your prototype. Later on, I was invited mysteriously to a secret White House conference call. Some colleagues of mine, multiples, sent me their copy of an invitation letter. And that White House conference call was interesting because the Ebola czar at the time, Ron Kaiser, said that, listen, we want you scientists that are out there in the community, you need to say what the CDC says. That the community trusts you, and we don't want you to instill fear in anyone. And he then said, because we have this nice NIH funding mechanism, and basically it's a shame something should happen to your NIH funding. Well, I didn't have any NIH funding at the time, and I had already left the University of Pittsburgh, and I was on my own. And I asked, there was a question and answer session at the end, and the question and answer session went like this. The first person that asked a question said, when you guys went to the West African countries, the NSF has actually been funding sociological, geopolitical research in these West African countries for the past 25 years. Why didn't you get a hold of us? And we could have told you who in those communities you should come to, so you didn't scare everybody to rush off into the jungle when you showed up with your spacesuits to test everyone. Ron Kaiser said, well, that's an interesting idea. Maybe we'll do it next time. I asked my question. There were a couple of other questions intervening, and my question was, could someone please explain why the director of the CDC, Tom Frieden, who was the director at the time, testified to Congress, a congressional committee, that when he was asked by a conservative representative, was he concerned that there were going to be any outbreak in the United States of Ebola? And he said, no, there's not going to be an outbreak in the United States. I'm not concerned because I would only be concerned, he said, to be accurate on the quote, if there was a mutation in this virus, and there are none. And I nearly spit my coffee out because I was analyzing the exact sequence data, comparing Ebola from 2014 to Zaire Ebola in 1995. And there were 396 mutations. And New England Journal of Medicine had published that there were 396 mutations, and I was validating and looking at the specific nature of those mutations. So he was misinformed. And so I had asked the question on this White House conference call, hey, could someone tell me why the CDC director is saying there's no mutations in this virus? Somebody misinformed him. I think he needs to be informed that there are mutations in this virus. And the question went to somebody from the CDC because nobody else could technically answer it. And the person answering the question was Stuart Nichols, the person that told me that CDC wanted to advance their own test, a PCR test. And I suspect, although I don't know, that the reason why they needed the virus to be 99.999% similar, which is what Stuart Nichols actually said on the conference call, he said there's not mutations, that's ridiculous. He said this virus is 99.9999% similar to the virus from Zaire. Now, it's just a matter of math. When you're comparing DNA sequences between two species, it's very elementarily simple. It's trivially simple to compare the sequences using a BLAST algorithm. The BLAST algorithm was invented by one of my postdoctoral mentors, Webb Miller. I had obviously used BLAST. I use BLAST today. And he lied. And I can only imagine that he was lying because he wanted, they have this paradigm that, no, this is the same thing because their PCR kit used primers matched to Zaire or something like that. That's a suspicion. But nevertheless, with all this packaging and shipping to CDC for validation by what? By CDC for Ebola? I'm very skeptical, especially if we have an outbreak where there is this kind of massive hyper exponential, but increase. How is the CDC going to handle the throughput? They can't even tie their own shoes in a molecular biology lab. That's a serious problem. The safety of the United States is dependent on the bioweapons. The safety of the United States is national security is dependent on this setup. Okay. Where CDC is supposed to validate everybody else's test. Well, I've been in other laboratories around the country, and I've worked in other laboratories around the country, and many of my colleagues are in laboratories around the country, and there is far more talent and creativity in the commercial and in the university laboratories than there is in CDC. Why is the CDC held up as the gold standard? This is unacceptable. It's impractical, and it's the wrong strategy. CDC can't even count the number of deaths from influenza properly. They say that there's more than 80,000 deaths in 2018. Where they got this from, this National Foundation for Infectious Diseases press release about this meeting that they had on September 27, 2018. So the 2017-2018 season is what we're talking about. They claim that there was more than 80,000 deaths here, 900,000 hospitalizations. And this is why people are saying COVID-19 is not a big deal. Look at influenza. Okay, here's the problem. For 10 years, from 2009 until 2019, the CDC website on this matter read as follows: CDC conducts surveillance for people who see their healthcare provider for flu-like illness. What about the people who don't see their healthcare provider, right? Through the outpatient influenza-like illness surveillance network, a network of thousands of healthcare providers who report the proportion of patients seeking care for flu-like illness weekly to CDC. The system allows CDC to track levels of medically attended flu-like illness over the course of the flu season. CDC does not know exactly how many people get sick with seasonal flu each year. For 10 years, they had this on their website, till two health freedom activists, Ali Fujito and Bernadette Pager, Ali from the Pennsylvania Coalition for Informed Consent and Bernadette Pager from Informed Choice Washington. The specific quote was put on social media by Ali, I think, and it says, in fact, when we actually checked the data, we learned that people whose deaths were reported as influenza deaths were not laboratory confirmed as even had influenza, let alone having died from influenza. All the final death numbers in CDC's National Vital Statistics reports, final death data up until 2016, always separated influenza deaths from pneumonia deaths. And for darn good reason, most people who have pneumonia do not have influenza. When you see 80,000 deaths from flu, they're talking about pneumonia plus flu, whether or not they have influenza virus in the first place. Okay, so there are many, many causes of pneumonia other than influenza. And Bernadette did her own legwork too, and she actually got this started. She wrote to CDC, and CDC in an email to her had written back, CDC does not know exactly how many people die from seasonal flu each year. And they give their litany of reasons. Okay? Now, if you go to the frequently asked questions of estimated burden, flu burden, right? And this is what we're talking about here, the influenza A plus B. This is the number that they report in terms of cases. They don't know the number of asymptomatic cases, the people that don't show up for medical care, but they use modeling to try to estimate it. And they get paid $12 billion a year to do this. They can't even count it right. But if you try to go to this webpage right now, this webpage is gone. It's been taken away. It was, I think, July of last year. It was terminated about the time that these health freedom activists started asking questions about this practice. So now we're just being told what the numbers are, and we're not being told the CDC doesn't know. And this is a problem because the CDC doesn't know. Their job is surveillance. Their job is an incredibly important job. This is the 10-year period from 2009 till about 2019. Well, the queries from the community were in 2018. And in 2019, they stopped disseminating the truth, which is what they don't know, the number of influenza cases. Oops. Can't seem to find the page. I lost the keys to the factory, folks. Thank goodness for the Wayback Machine. The CDC can't even count the number of influenza cases, right? So we're supposed to trust them with tracking and surveillance. We're supposed to trust them with testing. We're supposed to trust them with our very lives, our livelihoods, our prosperity, our health, and our freedoms. Well, it turns out that the medical community doesn't really trust the CDC after all. New York's making its own. EPMC announced they were making their own and doing studies. And that's the important thing. That's the distinction. To my knowledge, CDC has no data on the sensitivity and specificity of their test. See, if you get a test, regardless of the nature of the test, it could be a radiological assay, it could be a lateral flow assay, it could be a PCR test, it could be a symptomatic diagnosis. There is the ability to detect an illness or a condition. So the proportion of correct diagnoses that are out there where you say, yes, this person has the condition, a positive diagnosis. That's sensitivity. That's the ability or the power of the test to be able to detect something that's really there. Its specificity is the ability to say it's not there when it's not there. And there's usually a trade-off. In a very accurate test with 100% accuracy, you have 100% sensitivity and 100% specificity. The Germans calculated an estimate of their sensitivity and specificity. They have a reasonable scientific approach to this. The CDC threw a bunch of primers together, shipped them out to everybody, and just, okay, let's see what happens. And they're the gold standard for the United States. I'm embarrassed. I'm absolutely, abjectly embarrassed. And when I saw UPMC do this, I was proud. I was proud that UPMC is doing it. I live in Pittsburgh. I used to work with UPMC. I used to work in a UPMC building at the Cancer Center, UPCI. I was at the University of Pittsburgh. I was proud that they were taking this on. They weren't waiting around for the CDC to continue to screw this up. There's this lateral flow assay that's out there too, and I'm going to go into some detail about this lateral flow assay. What a lateral flow assay is, it's a immunoglobulin test, and this is an important test. It's by Biomedomics, and I downloaded this on March 15th. They published it on March 15th. Basically, you take a sample from a person and you put it into the assay. The assay gives you a reading, and you have your result. You get the blood, serum, plasma sample, okay? Not a problem. Easy to do. People can do it at home. Okay? You collect the blood, serum, plasma sample. You add the blood, plasma, serum to the sample well. You place 2 to 3 drops of buffer, then sample well. You read the results after 10 minutes. 15 minutes later, you got your result. You take a picture of it. You send it to your doctor. That's what I suggest we do. Okay? But that's not how we're set up. Our nation is not set up to use biomedomics. All right, here are the results. If you're negative, it's a single line. It's just like a pregnancy test. If you're IgM positive, it's this way. If you're IgG positive, it's that way. If you're both positive, it's here. Guess what they have? They have sensitivity and specificity characteristics of this. They've done their research. All right, there's the technical test principle, how it works. Okay? It's precise. It's validated in their lab by PCR. It's already pre-validated. You see the difference between real scientific pathology, that's what this is, diagnostic pathology, and whatever it is that CDC is doing while the rest of us are waiting on them. It's fast, 10 to 15 minutes per test. It's an intuitive visual interpretation, and there's no special equipment needed. In order to test the detection, sensitivity, and specificity, test science of the COVID-19 IgG-IgM combined antibody test, blood samples were collected from COVID-19 patients from multiple hospitals and Chinese CDC laboratories. The tests were done separately at each site. A total of 525 cases were tested, 397 positive, clinically confirmed, including PCR tests, SARS-infected patients, and 128 non-SARS-CoV-2 infected patients, 128 negative. The testing results of vein blood without viral inactivations were summarized in Table 1. Of the 397 blood samples from SARS-CoV-2 infected patients, 352 tested positive. Now, it's not perfect, but it has a sensitivity of 88.66%, and that's pretty good. In terms of, a first pass at this, these are the people that don't have sufficient viral load, or there's something different about their immune system. It's pretty good, right? But it's a 12% false negative test. See that? So 88% is about 11 or 12% false negative. We don't want false negatives. So this test should be improved upon. 12 of the blood samples from the 128 non-SARS-CoV-2 infection patients tested positive, generating a specificity of 90.63. So there's about 10% false positive rate. Not bad for only being out March 15th. That's kind of remarkable. So here's what would happen. The people that tested positive, 88% of them would be triaged and sent home. Now let's do some modeling. If there's a 10% false positive, or 11% false negative, right? And then they were continuously tested because they were in contact tracing, or they were in contact or in a household that had it. Eventually, when their immune system kicked in, they would likely test positive. So you would have clusters instead of a national outbreak. 12 of the blood samples of them tested positive. So 10% of the people tested, would they be at risk of having to be quarantined? Well, not unnecessarily. That's not 100%, is it? If we'd use this test on 100% of the population right now, there'd be 10% of the population under quarantine unnecessarily and another 10% walking around that shouldn't be. That's a lot different than everybody walking around, though. A lot different. So, I really recommend that we look at in-home testing. The test kits should be sent and they should be acted upon. Now, here's the problem in the United States. And this performance evaluation from Biomedomics, their website also says, unfortunately, a negative result doesn't allow us to say you're truly negative, and they're being forthright about it, but they know it, and that's the difference. I don't know the sensitivity and specificity of the CDC's test. I don't think anybody does. It's never been published, to my knowledge. I've asked for it, and we're going to get into that in a little bit more detail, but at least you get the testing done, and if you're positive, you are given the instructions on what to do, and that's the difference here. Think about it, we could get 88% of the people that are positive off the streets. That's how you have to look at this, right? Now, the kicker is, and you guys are not going to believe this, the way that the laws are written right now, the way that things are set up, if this test tests positive or negative, other samples still has to go to the CDC for validation with their PCR test. It's patently foolish, wasteful. It's a waste of resources, a waste of time, a waste of money to take a validated test result and validate it with an unvalidated test. What does the CDC say about this? Is Dr. Messonnier on February 28th. February, folks, last month. As more cases have been identified and more cases have been available, it is clear that 2 of the 3 reactions, we actually are appropriately sensitive and specific in identifying cases. Show us the data, CDC. Show us the ROC curves, receiver operator characteristic curves. Show us the tests on artificial samples like right? I don't even want you to do that. I want you to just pack your bags and go home. You don't belong in the game. You're redundant. This is further from the original transcript that I read to you for Dr. Messonnier. Right now, labs can start testing with existing CDC tests. So what? So what if they can start? We don't know what it does. We have no idea what it does. Just because I can start up a race car doesn't mean I know how to drive it. States that were able to validate their kits should continue to test in this manner. What? So as long as it looks okay in your lab, if our kit looks good in your lab, go ahead and continue using it. No, we're going to abandon your test because it's failing somewhere. Okay. States that were able to validate using only 2 components specific to novel coronavirus can test using only those 2 using revised instructions developed at CDC, made up as they went along. Unvalidated, subject to confirmation bias. We have established that the 3rd component, which was the cause of the inconclusive results, can be excluded from testing without affecting accuracy. We have been working with the FDA, and they agree with our approach. While we're working to amend the existing EUA, Emergency Use Authorization, FDA should pull it. FDA needs to pull that authorization. We have discretionary authority from FDA to proceed in this manner. This will increase testing capacity with an unvalidated test at state and local health departments with an unvalidated test. All positive test results will continue to be confirmed by CDC for some time. Why? They're using your test. You don't validate your test with your test. That's not validation. This is utterly foolish. Molecular pathology doesn't belong in the hands of these people. Additionally, CDC has manufactured brand new test kits that will only include the 2 components and that are specific to novel coronavirus. In other words, they were trying to corner the market on coronavirus testing. Those test kits are at the International Reagent Resource where orders can be placed. We are working as quickly as we can to get CDC test kits to state and local public health authorities. However, during any infectious disease response, there's a great need for test manufacturers to rapidly make testing available in clinics, in hospitals, and at the bedside. In other words, this is CDC speak, okay? Right here, I'm going to invent a new word here. It's called CDC speak. However, we acknowledge that the manufacturers are probably going to make their own tests, and we're okay with that. Nobody asked you your opinion. We're going to go ahead and do it anyway. This is part of a huge effort within the U.S. government, but led by HHS. Not really. No, not really. I don't think anybody in their right mind would ever send a test to CDC to be validated from this day forward. You'd be crazy. And please, when you share this video, molecular diagnostic laboratories would be crazy to send their samples to CDC to be validated. Crazy. This, for completeness, was the date that FDA so-called relaxed their restrictions on non-CDC testing. CDC doesn't have a choice in the fact that the world's moving on from them in terms of testing. But if we go back to the biomedics, look at PCR nucleic acid test versus biomedics rapid test. The turnaround time is greater than an hour. Yeah, right. They're being nice. The PCR tests take greater than an hour, and then you have to send it to CDC to be validated with a PCR test. 15 minutes. Stay home or don't. Okay. Facility requirement, PCR laboratory. You could do this in your bathroom. Requires trained technicians, whole blood, serum, plasma. Just poke your finger. Requires like a prick for sugar testing. No big deal. Requires expensive equipment. It can be used anywhere, including airports. Complicated operation. No specialized training required. Prone to false negatives. Results are clear and easy to read. Requires cold chain, room temperature. You don't have to have a special PCR machine. Commonly used gold standard. That doesn't mean anything anymore. The gold standard is tarnished. The gold standard has turned out to be painted lead. Highly specific, can detect silence infections. Okay? Because they've done their research, they've done their science, right? We want public health policies based on science. I've been saying it for 4 years. This is the address for Biomedomics, and I have no financial disclosures, no relationships with Biomedomics. So they're in Morrisville, North Carolina. This is not a paid endorsement. There is no quid pro quo. Let me say it slowly. And to find out more, 919-890-3070. Make this go viral. Send it to your doctors right now. Send this to your doctors. Write this down. I'll leave it up here for a while. Take a picture of it with your phone. If you're watching this on the computer, come back to it and note the time in the broadcast. Biomedomics. I don't know this company from anyone, but I do know that this test was used in China, and China has ended their outbreak. Okay? So I've been in contact with the FDA about this, and specifically Timothy Stenzel, about the CDC's performance evaluation. I wanted to know, are there evaluation measures? Is there a sensitivity measure? Is there a specificity measure? And I sent the FDA my own results of looking at the CDC test components to see if they matched human proteins. There's some positive controls in there that have to match human proteins, but I was concerned over some of the results that I saw, so I sent it along. And I've notified the CDC as well about what I found. And I wrote to Mr. Stenzel to find out where the performance evaluation measures of the CDC PCR COVID-19 tests are. I did this today to make sure it was updated. I waited till the last minute. This was just minutes before I went online, and I got this result back, this reply back. Well, a couple hours. I guess it was 12:25 p.m. And it's they sent me a link. Tim sent me a link to the EUA letters for all of the people, all of the companies that have EUA letters, okay, for their tests. And I went through and I read each letter. There's a good number of them. I think there's about 18 different companies that are making PCR tests. And I did note that some of the letters went out with requirement of negative controls to assess off-target amplification, including the PCR test by the CDC. And I asked him if there was any testing done similar to that was provided by the German test by the Germans for the CDC's test and these commercials test. And this is where I became an advisor here. I would strongly advise that you recommend to each manufacturer to conduct such testing as they proceed with their rollout to avoid further delays and problems. I apologize if this is already a requirement. We are not at the place where we have a validated CDC test. How can they validate the results being sent to them? This is criminal at this point. And if another CDC employee says to anyone, to Congress, to a congressional committee, to the press, to anyone, that they can validate other people's tests, they have to show the data. I need the sensitivity and specificity so we know what we're talking about. It's absolutely criminal from this point forward. And Tim wrote back and he said, I've shared your comments with our team. Thanks. So what I'm asking for is science. I'm not imploring, I'm just asking that they actually conduct science on these PCR tests. Because what we're seeing is problematic. This is a resource. I didn't steal that image. It actually came from a resource that I have the link. And by the way, there's a companion article on my blog website, jameslyons-weiler.com, that will have all the links to all of this. And I'm going to publish it right after this presentation. But there's 290,000 total tests as of today conducted in the United States, and over 90% of them are negative. But the question is, how many are false negatives? And until we know that, we really don't know whether the test is helping us or continuing to harm us. The CDC, remember, wanted their own test, and they were already given data about the performance of a test that was just like theirs. It was the PCR test. They could have adopted it like 60 other countries did, like South Korea did. They could have adopted it. We could have been testing back in March, early March. All of the new cases of coronavirus 19 that have happened and all the deaths that have happened from those cases that were not found by tests fall squarely on the shoulders of the people of the CDC that made the decision to have their own test. That's why IPAC, the Institute for Pure and Applied Knowledge, of which I am the CEO and the director, has issued a biodefense strategy statement on 3/23/2020, the current situation in terms of the exponential increase in the number of cases of COVID-19 and deaths from the infection, the lost opportunity for the medical community to be ready, school closures and the isolation in place, the loss of income, general disruption of how our society functions, and the awesome losses in the private sector were all utterly avoidable and can be traced directly to the CDC's decision, which it continues to make to refuse to adopt an already validated test from Germany. The fact that the public and the medical community alike have, even now, not been told the exact nature of the flaw or flaws in the CDC's test is utterly unacceptable, profoundly unacceptable. We are deeply concerned that false negatives continue to drive the rate of spread of SARS-CoV-2 in the United States. We urge all laboratories to use validated non-CDC test kits. Do the science yourself. Do what the Germans did. Get a hold of the German study, it's peer-reviewed, and replicate it. These events demonstrate that the centralization of risk detection, surveillance, modeling, diagnostic testing, and public health policy in one location with one culture with limited human resources places U.S. national security at risk. These events have proven CDC to be unskilled, unresponsive, redundant, and in reality a dire threat to public health during a pandemic in which accuracy and timeliness of responsiveness is critical. Major U.S. universities and hospital systems all house talents in diagnostics that are vastly superior and that are also, by definition, more diverse. Decentralization of public health responsibilities is highly recommended. For reasons related to national security, CDC should no longer promote its test, nor should it serve as a centralized validation center for testing for infectious diseases. Those involved in the decision to refuse the validated test from Germany should resign. Those who have misinformed the public and Secretary Azar, thereby the President of the United States, should resign.